raise the insulin last night. I got cramps in my legs.
We are close to being on time, not quite, but we still have, we have a quorum from this morning, so we can continue on. First on the agenda is Representative Halverson. Good to see you.
Good to see you,
Oh,
Chair.
House File 5. This
You may
is
have
what,
heard
the
of it.
fourth time I've seen it now?
And it keeps getting better.
You just like to show up and, never mind. Again, this bill has seen numerous committees.
They're smarter than we are.
Numerous committees. So members, this is a finance committee. This is the finance committee for all three of these bills tonight. So I am asking that we try to keep the questions as close to the finance issues on it as possible. And I'll probably be reminding members as they arrive of this. So Representative Halverson, I will move House File 5 for, it's staying here?
No, it is.
Going to Ways and
Ways
Means.
and Means with a recommendation to go to State Government Finance.
With a so I'll move House File 5 to Ways and Means with a recommendation to go to State Gov Finance.
Thank
You're
you,
on.
Mr. Chair. And there is an author's amendment to the bill as well.
Is that the 812?
Yes, Mr. Chair, I believe so.
All right. I will move
Yep.
I will move the A12 amendment to House File 5. Would you care to explain it a little bit, or is that not finance?
Mr. Chair, I can just let everybody know that I have had amendments along the way at every committee stop that reflects the previous conversations. And so there's some language in here that clarifies further what to do with independent contractors and self-employed individuals. And then there are extensive amendments to inserting all of the finance information, including the premium. So there's extensive finance information that has been added that the commissioner can speak to.
So would you care to explain what you're doing with that?
The amendment?
Yeah. Is it just finance, or is it?
Well, I think it is important to remember I can just explain the independent contractor piece because it's been a question that's been sitting out there, and a lot of other states that have passed paid family and medical leave have had a lot of questions about how to deal with the independent contractor language. And so I think it's important for members who have seen this bill before and people in the audience who have been following this that we have a lot of folks in this state who earn money in a lot of different ways, and we want everybody in the state to be able to have access to this program. We want to be sure that they can be a part of it, but at the same time understand that we as a state are limited in terms of how we treat independent contractors. We want the independent contractor as a self-employed person to be able to be in charge of their own benefits and opt in. And so this clarifies who an independent contractor or a self-employed person is. And it makes it very clear that if you have statute that currently governs you as an independent contractor in some way and language. The good example is real estate agents. While they might hang out a shingle on their own, they're tied to a agency very often, and we don't want them to. But they don't consider themselves an employee. They consider themselves as a small business owner, and so we want that to be reflected. So the way that they're reflected in state rules, labor and industry rules, are the way that they're treated in this bill. And the same would be true for anybody else who is covered under rules or statute, state or federal statute. We did have to add specific language with regard to insurance agents because there actually wasn't anything else in statute or rules that described their independent contractor status. So we made it clear for those folks as well. And we did this in collaboration with a lot of these groups. We also went through and clarified the finance pieces of the bill. One of the things I think that's incredibly important, and that's something that we've all been waiting for, I think, with with bated breath was to see what the premium rates would be for employers and employees. And like the study that we have been working off of predicted, it came in at 65 or 0.65%. So it's 0.65 of 1% of somebody's average wages is the premium rate that we came in on, and that's really good news for the state. It means that we are working with a program that is going to be run very efficiently. The estimated administrative costs are coming in under budget, and the premiums are coming in right where we thought they would be. So we're basically looking at premiums being about a cup of coffee, basically a week. I go through way more coffee a week than 1 cup. For an employer to pay full freight for the employee. The employer also has the ability to charge back up to half of that premium rate. So it would be a shared responsibility.
So if I might ask, just to clarify, the employer has the opportunity to pay the full rate or split that with the employee, correct?
That is correct. Yep, we left that optional in the bill so the employer can do either. Some employers actually are choosing to currently pick up full freight for instance, the short-term disability for their employees. Some charge back part of that premium. It would be a similar type of a setup.
And then, if I may, so if you're an independent contractor, self-employed, you pick up the full 0.65.
Oh, I'm glad you asked. One of the things that I wanted to be sure of, because people who hang out their own shingles very often are kind of paying both employer and employee shares. So you pay employer-employee shares on Social Security and FICA and other payroll withdrawals. I did not want to see this kind of similarly double up for independent people who are independently employed. And so we're looking at, it's calculated to be closer to 2/3 of that premium. And so, did I get that right, Sully? It is half. Okay, sorry. The math has been updated. The goal was to get it to half. So basically, you're paying the employee share, if you will, in order to make sure that people who are working on their own can have access to the benefit. I've heard from a lot of independent employees who really want to see access to this benefit. I talked specifically to a hairdresser who said one of the most startling things I'd ever heard with regard to paid family leave. And she said, I can't ever leave this chair. If I leave this chair, I'm not earning. And she said, if I had access to this program, I could go have a baby. And the fact that somebody is putting off growing their own family because they can't walk away from a paycheck for a period of time really says a lot about the future of our economy in Minnesota and the decisions that people are making because they have to live paycheck to paycheck and really can't take the time they need to grow their families or care for loved ones or care for their own illnesses.
So, is there more that you want to explain about your amendment, or should we go to a vote? Or questions, actually, I should ask.
You can, it is the chair's purview at this time, what you would like to do to move forward. The amendment is considered to be an author's amendment, and so it would get the bill in the shape that I would like it. So we can take questions before or after.
Well, we'll get it in the shape that you want, and we'll allow you to explain the finances of your bill. And then, so all those in favor of the A12 amendment signify by saying aye.
Aye.
Opposed, same sign.
No.
You have the bill in the shape that you want. You want to explain your bill, and then do we have another amendment? Or do you want to, is this Representative Haley? Did you want to do your amendment before we get started? No.
Well, thank you, Mr. Chair. And thank you, members of the committee. House File 5, many of you have gotten to hear this already. There's a few folks who haven't had the opportunity to hear about this bill. House File 5 is a bill to create a fund in the state of Minnesota so that all employers will be able to offer paid family and medical leave to their employees. Currently, under federal law, everybody's entitled to 12 weeks off. However, that time off is unpaid. Your job is protected, but in order to take those benefits, you have to be able to go without a paycheck. And you think about the people in your life, you think about the constituents in your community who come and talk to us. I don't know many people who can go without a paycheck. This bill puts Minnesota in line with numerous other states who have put this on their books or are considering putting this on their books. It's an idea whose time has come. About 14% of people in the country have access to paid family and medical leave through their employers now, and they are the lucky ones. And Minnesota employers have really been leading the way because Minnesota employers have understood what the economic and business benefits are to employers. It makes you very attractive as an employer. It keeps your employees coming back. At a time when our job, when our workforce is facing shortage after shortage in every single industry, being a competitive employer is incredibly important. And it's something that we passed for our own state employees a few years ago for that very reason. We want to put all Minnesota employers in that position of being competitive and being able to attract workers. I've talked to numerous small business owners who have said they have watched people walk out the door for benefits at a company like General Mills that they couldn't match, and this would help them match, and this would help them compete. It would also have a benefit of creating a healthier and more robust workforce. So who needs paid family leave? We know that the people who take paid family and medical leave in other states take it primarily for their own illnesses. The way I keep thinking about this bill this year is think about the unexpected. And the ice and snow this year has created a lot of unexpected accidents for people. In fact, people in our own legislature who we've been missing because of a slip and fall on the ice. I know personally a number of people who have had to take serious time away because from their work because of a slip and fall on the ice that has left them seriously injured. It's also meant their family members have had to take time away from work. The next group of people who are likely to take paid family leave are women who are experiencing a high-risk pregnancy, and that is covered under the medical leave portion of this bill. When you have a high-risk pregnancy and your doctor recommends bed rest, you best take it. If you don't, it really does have a huge impact on birth outcomes. In addition, parents who want to bond with a new child, and that's not just a nice to have. When you're a parent, that's a have to have. It's a have to have for the brain development of our children. And it's also an incredibly important time early in the new bonds of a family. Family bonding is important. My family adopted a child, and that bonding time was incredibly important, and families need to take it. And finally, it's people who need to care for other loved ones. And so you think about a family member who is undergoing cancer treatment or a family member who has had an accident and wants to avoid respite care in a nursing home and be cared for in their own home where you get better rest and better health outcomes. That's who takes paid family leave. And so it's for the highs and lows in life, the joys of having a new baby or the struggle of having cancer. That's who needs paid family leave. And so it's not a select group of people. It really is all of us because all of these things are issues that families face at any given time. What do we get for paid family leave in Minnesota? We get a lot. We get lower health care costs because we get better birth outcomes. We avoid the expense of care in nursing home or other facilities because people are being cared for by their loved ones at home. We had been built on a society where free care was kind of part of the deal. We had people at home during the day with children who could afford it. We had very often family members caring for loved ones rather than having professional institutionalized care. And Minnesotans care for one another, and they still want to provide that kind of care. But foregoing a paycheck is often a hurdle to that. We also get a lower demand for public assistance. People who do take unpaid leave have a much higher rate of having to depend on public assistance for a portion of that leave, and I think that that's really important to note. We also get higher workforce participation. California passed paid family leave a number of years ago, and workforce participation among women with small children went up 10 to 17% around the state. When we're looking at a time when we need every possible person getting involved in our workforce in order to continue to move our economy forward, that's a really important benefit to our state. And we also get higher worker retention. People are much more likely to return to a job if they have this benefit. It allows them that elusive work-life balance that we all are asking for. And so I would like to introduce the Commissioner of the Department of Employment and Economic Development to talk about the finances of the bill, but I wanted to kick it off by starting with the benefits of the bill. So if I may, I'll turn it over to the Commissioner.
Welcome to the committee, Commissioner. Please identify yourself for the tape and enlighten us.
Mr. Chair, Representatives, my name is Steve Grove. I am the Commissioner of the Department of Employment and Economic Development, and I'm thrilled to be here on behalf of the Governor and Lieutenant Governor, who are thrilled with House File 5 and its potential to transform our labor market here in the state. We think this is really important. As Representative Halverson mentioned, as everyone in this committee well knows, we do have a huge talent shortage in the state. We got about 140,000 open jobs and only 80,000 people looking for them. So we have huge gaps across all kinds of sectors in this state. And this is the kind of program that we think makes Minnesota a more attractive place to work and a more attractive place to do business. Coming from the perspective of DEED, we always look at the economic impacts of this type of a program, and that's where our focus is in thinking about the value of this legislation. And as Representative Halverson mentioned, we are at a place where, particularly for women who take leave for children, their labor force participation rates jump significantly. California studies have shown that. Several New Jersey studies, another state that has implemented a similar program, have shown the vast majority of employers say this improves both work environment and morale. And you see the same thing in other states that have implemented this program. In regards to sort of implementation of the program, when we look at the ways that this is unfolded, most employers see no challenges. We saw actually zero challenges for abuse in the state of New Jersey, for example, of employees taking advantage of this program when they shouldn't. And a vast majority of those surveyed saw no effect on productivity whatsoever. So we do think this is a business-friendly policy. The devil's in the details of how much it's going to cost and how we put this together in a way that is attractive to both workers and business. So I'd like to shift now to talking a little bit about the fiscal note for this legislation, and I'll walk you through the math of how my team has looked at what this will cost and would love to answer any questions that you have about it. So, as Representative Halverson said, the way that this program would work is very similar to the unemployment insurance program that DEED currently administers. We've administered this program for decades, and it's really based on an insurance pool. You take a payroll tax from every paycheck of a worker, it goes into an insurance pool, and then any worker who qualifies for the benefits that are laid out in the bill pulls from that pool every time an instance that qualifies for them to receive benefits exists. So that's how it works, and therefore the calculation we need to do at DEED is figuring out how do you build a fund that is solvent to pay out those benefits over time once the program is fully up and running. So let's start with that calculation. What we did first is we worked with the Department of Revenue to look at what our taxable wage base is in the state. And the most recent full year numbers we have for that are 2017 numbers. And that nets about $139 billion. That's our taxable wage base we'd be pulling from to fund this program. You then got to figure out, well, what will the take-up rates be? What will people, how much will people take advantage of these benefits, and at what percentage, to figure out how much the benefits themselves are going to cost. Fortunately, since other states have done this program, there exist models we can reference to see what we might expect to pay out. In Massachusetts in particular, there has been a detailed model built by the Institute for Women's Policy Research that leverages the Massachusetts experience in this space and allows any state to plug in the details of their policy, their population numbers, their demographics, and the data around the policy. It references it against the data we have from family and medical leave to estimate take-up rates across all of the different qualifying instances for this program. If you turn to page 9 of your fiscal note, you'll see those take-up rates there for your own health, for pregnancy, for bonding, for family care, for qualifying exigencies, et cetera. So we use those percentages that the IWPR has used, and we didn't just sort of take that off the internet. We called them, we dug into the research, we spoke to the people who built the model to really make sure that we were comfortable with it. I had my labor economists have a detailed conversation with them. We want to make sure that we are comfortable with that model, and we are. It's a good model. And so we use that to calculate what the benefit cost would be, and we expect that this program on an annual basis would pay out benefits to the tune of about $780 million. So that's how we calculated the benefit costs. There is an additional provision in this piece of legislation that we think is very business friendly and that does not exist in other states that relates to subsidizing smaller businesses to replace workers who are on leave such that they're not stuck out in the cold with less workers when a worker has to leave for one of the qualifying conditions here. And I think it's a thoughtful piece of legislation. It applies to companies that are 50 people or under. Again, no other state does this, and the amount of the grant and of the subsidy would be about $3,000 per employee to help that firm replace that worker with a temporary worker and ease that burden in situations in which someone takes that leave. The bill in its current status estimates that 25% of eligible employers will take advantage of this program, and so the total cost of that subsidy program for this legislation comes out to about $75 million. The 25% is our best estimate. I'll be honest. There's no track record to sort of used in terms of take up there, but we thought we'll start there and see what we get to in terms of the estimated cost of that piece of this program. So you add all up that, the amount of money that would be spent every year on this program to workers and businesses is about $855 million. But of course, you have to administer the program. So that requires administrative costs at deed. And so we needed to calculate that as well. And fortunately here, again, we have some models to leverage versus just sort of whiteboarding it, what it would take. I think, first of all, we have our UI program at deed, which is very similar in its structure that we leveraged to make this estimate. But more importantly than that, there's also a model that the federal government has built for UI programs across the country called the Resource Justification Model. And this model was built by the federal government to ensure that states don't game the system or commit any fraud with regards to how many heads they hire to administer a UI. Because remember, UI is a federal program. States are just administering it at the local level. So that model is tried and true. It's been around for over 10 years, I think actually over 20 years. And when we ran that model for this program, it came out to 323.45 total FTEs to run this program once it's up and running for paid family medical leave. What do these people do? They're operating call centers. They're administering the benefits themselves. They are ensuring that IT is in place, and all the kinds of programmatic needs that, for example, UI currently has, but apply to paid family medical leave. You may ask, well, couldn't you just use the UI system or the employees that do that to apply to this program? You can't, because that's a federal program and this is a state program, and you need to keep them separate. We also have a full workload for UI. Both models, by the way, have flexibility built into them as demand goes up and down. So, for example, if you're curious, our UI program in the state has a fluctuating worker base depending on the state of the economy, such that we can bring in more temporary workers to fill the call centers when unemployment's high and then ratchet back down when it's not. So we try to be really thoughtful about headcount in these types of situations. So with that estimate of 323.45 people, again, it's a model, so we're down to the decimal point, we get yearly administrative costs of $45 million and change. You can see it in the charts in your book. So those are the yearly admin costs once the program's up and running. Again, that's really just people and overhead related to the people. So when you add up those admin costs with the benefit costs and with the subsidy program, the total cost of this program year over year, again, once it's up and running, is $900 million, $355,000, and $235. Sorry, $900 million. Let's just say a shade over $900 million. So, I need to get my decimal points right in there, but that is the cost. So that cost then against the taxable wage base we have in the state yields the premium rate that Representative Halverson spoke to earlier, which is 0.65%. So that's the magic number. That's what we have to get to figure out what do we have to charge on every paycheck for every employee to make this program solvent. It's 0.65%. Again, the bill demands that employers pay at least half. They can also pay full if they so choose. But that's the premium rate once this program is up and going. Now, we got to build the program. So I'm not quite done yet. We want to talk about what it would take to get to that point. And this gets to the general fund ask in the budget to ensure that we can build a paid family medical leave program. So to do that, we got to build both an IT system and build a staff that can run that IT system and start to collect the benefits to get us off the ground. Let's start with IT. So the IT costs in the system are helpful to think about in two phases. Phase one is building the platform that will take in the benefits in that first year. So importantly, starting on January 1st, 2021, we start collecting the payroll taxes, but we don't start paying out anything for a full year. So we fill the coffers of the fund early with the platform, and then a year later, on January 1st, 2022, we start paying out benefits. That's important for a couple of reasons, and I'll get back to that in a second. But to think about the IT development here, again, it's phase one, benefits collection, phase two, benefits payment. We looked at the costs of building such a platform by referencing what we have done for our unemployment insurance program. So we have that reference to take a look at. We spoke to the state of Washington on what they did to build their system. They're still under works, but we use that as a reference. And then we also looked very closely at the legislative auditor's reports on other Minute tech builds to ensure that we would have appropriate number of Minute staff to fund this project. And again, this estimate was led by Minute. Deed gave information to help them come up with it, but really they're leading the estimate on IT. And the system would be hosted by AWS. We would hire an outside contractor to build the system, but of course we'd have Minute staff tackling it as well. The total cost of the system that would take 4 years to build, but this bill funds that entire 4 years, is almost $67 million to build the program. And then there are ongoing costs to maintain the system, which are about $5 million. You might ask, well, why not use the same system as Washington State? Can we just license the system that's already out there? The specifics of the program, we can look into it, would be my answer, but the specifics of the program are unique enough that we want to start from the place that we probably need to build our own system. But of course, we'll always look for cost savings if we can. But we feel good about this estimate because it's based, again, on conversations with the vendors and other models that we've taken a look at. So that's the IT build. That entire cost, even though the IT build would take longer than 2 years, is all in the bill now because we want to make sure we're solid on the IT costs. Last is the admin costs to operate the platform and to get it ramped up. And so when you look at that, we again went back to the resource justification model for the number of full-time heads we need in those first 2 years. In other words, we got to pay for heads before we start to use the fund itself to fully fund the program. And those costs get us to about 70 people working on this by the time we're up and going to pay out the benefits, which nets out with overhead to about $8 million. So when you add that to the $66 million it would take to build a platform, we need an appropriation of over $75 million just for deed to build the system and get it up and running. So again, just to retrace our steps, $75 million to build the system and staff it to get ready by the time we're paying benefits. About $900 million year over year to pay for this program once it's going. But again, it pays for itself via the premium rate. Now, of course, we've used the best estimates to estimate take-up rate, but that, of course, could change. And so the legislation allows the Commissioner of Deed to change the premium rate as needed to ensure that the fund remains solvent. We do the same thing for UI. The good news about taking a full year to collect the benefits before we start paying them is that if for some reason our estimates were off by a significant amount, which we don't anticipate they would be, but if they were, we have a full year of payments already in the account to start delivering benefits such that we wouldn't be in risk of being insolvent right away. So that's a lot of numbers that I just threw at you, but I wanted to just be diligent about how we've costed this out. Again, it's a program that pays for itself once it's up and running. We've got to do the grunt work to get it into a place where we're off to the races. But we're thrilled about this. And we think that given the expertise that exists at Deed in a similar program for unemployment insurance, we've got the right people on this. And of course, we're building on a new division of Deed to tackle it, but it's worth it. And we think it'll be a great part of developing the state's workforce for years to come, and are optimistic and hopeful this will pass and become law.
Thank you. Next would be, and you're going to be around for a while. I suspect.
I can be, or I can answer questions now if that's easier too, since it's fresh in people's minds.
If you ask politicians to start asking questions, we won't get to the other witnesses.
Okay.
So you're going to have to stick around for
All
a
right.
while. Commissioner of the Department of Labor and Industry, Nancy Leppett.
Mr. Chair, Commissioner Lepnik is here and willing to answer questions. She's been very involved in the drafting of this legislation, but I don't think she needs to testify, but is available for questions.
Commissioner Jan Malcolm.
Some of them.
Good evening, Mr. Chairman and members of the committee. I'm Jan Malcolm, Commissioner of the Minnesota Department of Health. It's a real pleasure to be before your committee this evening to talk about this bill, which clearly is an economic issue, but paid family leave is actually also a very important health issue. In fact, it might surprise you to know that when it comes to maternal and child health, this may be one of the most important actions the legislature could take to help us improve maternal and child outcomes in our state and to address some important racial and ethnic disparities in those outcomes. Quite simply put, with paid leave policies in place, people are healthier. Representative Halverson has also already kind of laid out for you some of the core ways in which this is true. People with paid family leave actually end up using less health care, and their children do better, not only in health outcomes, but also in school settings. The specific list of health benefits from paid parental leave is really pretty impressive and might surprise you in terms of some of the things that are associated with paid family leave benefits. Both short and long-term, not only health benefits, but healthcare cost savings. What is clearly established in the literature is that with paid family leave, paid maternal leave in specific, improved rates and duration of breastfeeding are observed. And we know quite clearly the association between breastfeeding and improved childhood nutrition and development, and also protection from infections. We know that there is better physical and mental health established for both mothers and children with paid leave. There are sharp decreases, like by a factor of 50% decreases in hospital readmissions for mothers and infants in the presence of paid family leave. We know that there are lower rates of infant mortality. In fact, since the U.S. is the only country in the Organization for Economic Cooperation and Development without paid family leave policies, it is hypothesized and documented by many researchers that this is the lack of paid family leave in the United States is thought to be one of the leading reasons why the United States ranks so low in infant mortality outcomes compared to our OECD peers. This might seem really counterintuitive, but I have a really powerful memory of hearing a former Surgeon General of the United States when talking about how can it be that with all of our medical technology, with the explosion in healthcare capability and healthcare costs over the last several decades, the United States has actually fallen in our international rankings with respect to infant mortality. That is a terribly tragic and counterintuitive outcome. But what the Surgeon General then went on to say is this isn't just a matter of inadequate prenatal care or inadequate immediate postnatal care. It is, in no small measure, attributable to maternal income security. And when you really start to unpack it, it makes a lot of sense. All of the things that come with maternal income security in terms of the security not only of the mother but of the family. Representative Halverson mentioned the importance of strengthened family bonds, which the neurological and behavioral research is just stunning on the importance of very early childhood for early brain development, so predictive of health outcomes and educational outcomes long-term for children. That first literally 1,000 days is a critical window of opportunity for not only for relationship development between parents and children, but for that child's brain development as well. Decreased chronic stress is also associated with paid family leave. And stress, as again, the science is just becoming abundantly more and more clear about the multiplier effect of chronic stress on health conditions. It's thought to be either the cause or a significant exacerbator of the great majority, actually, of healthcare visits. It's kind of a stunning thing to learn. But as the biology is getting more and more well established on the biological impacts of stress, it makes sense. In addition to these immediate health benefits, higher rates of well-child checkups, timely doctor visits when children are ill, higher vaccination rates, and a range of other healthy child development milestones are also found in the presence of paid family leave. We've talked a lot about the clear benefits to early childhood development and to maternal health, but family medical leave also is a health benefit throughout the lifespan, associated with health benefits both for the caregiver and for the members of the family that are receiving the care, as Representative Halverson also mentioned, when family members are ill or injured, recovering, or elderly, and they're able to receive care from a family member without relying on medical care or institutional settings for their recovery. The benefits to both caregiver and patient are immense. These are also important issues of health equity, as I mentioned at the outset, because we know that people with lower incomes, part-time workers, single parents, the most financially vulnerable folks in our community also are disproportionately populations of color and American Indians. They also have the greatest gap in their ability to access not just the job protection that they are entitled to, but as Representative Halverson said, these health benefits are strongly correlated with the paid part of the leave, not just the ability to take the leave. And so the differential access to paid leave for lower income workers and as I mentioned, the disproportionate representation of populations of color and American Indians in the group without access to paid leave just creates this cascading effect on families and communities, contributing to the health disparities which show up in a whole range of indicators. So I very much appreciate your consideration of this important measure. As Commissioner Grove indicated, it seems a solid economic investment in our workforce and in growth for our businesses, but I just am happy to be able to share with you the perspective that it is a powerful tool for improving the health of our people as well. Thank you for your consideration.
Thank you, Commissioner. I had hoped to keep this bill, each bill, to about an hour. I think we're losing control at the moment, but I'm sure, I hope I'm going to make a mess of this name. Barty Wally? Thank you.
Hi.
How bad of a mess did I make of your name?
No, you were super close.
Oh, there.
Really close. So, no, it happens all the time. It was awesome. Good evening, Mr. Chair and members of the committee. My name is Barty Wahi, and I'm the Executive Director of the Children's Defense Fund of Minnesota. Please note that the following testimony is a joint statement that's been prepared in partnership with AARP of Minnesota. AARP and CDF Minnesota stand together in support of paid family and medical leave because the responsibilities of caregiving touch all of us at some point in our lives. House File 5 allows us as individuals and families to maintain some of our income while providing caregiving that ranges from the birth of a new child to long-term care. Specifically speaking on child care, 80% of children have both parents in the workforce at the time of that child's birth. And 1 in 4 women return to work only 2 weeks after giving birth. I know after the birth of my own son, 2 weeks out, I was just achieving brushing my teeth on a regular basis. Infant care is the most expensive form of care at an average of $310 per week in Minnesota. With paid family and medical leave, parents need not leave the workforce to care for their newborn, nor do they have to cobble together friend, family, and neighbor care. It can also offset the costs associated with public support of childcare. When comparing all of these options, paid family medical leave is by far the most affordable option for both the family and the state. With respect to long-term care, House File 5 represents a cost savings by delaying expensive nursing home care costs that are often paid for at taxpayers' expense. According to AARP research, There are more than 600,000 family caregivers in Minnesota providing care for family members over the age of 18. The economic value of this care is estimated at $7.8 billion annually, saving taxpayers hundreds of million dollars every year, and often at the great personal expense of those caregivers in terms of lost wages and income. When it comes to caregiving, we have a simple choice. Do we want to be a state that continues to play a reactive and expensive role in supporting caregiving, or do we want to take a more proactive and strategic position that allows Minnesotans to be able to support themselves at a fraction of the cost? We can no longer wait. Paid and family medical leave allows Minnesota to implement a fair and just system that ensures all of our state's youngest and eldest have equitable access to care they deserve. Thank you.
Thank you. Emmanuel Nyman? Thank you for coming in this evening, and please provide our testimony.
Thank you, sir. Good evening, Mr. Chair and members of the body. My name is Emmanuel Naima. I am a leader with Barbershop Creating Change in the Community, and the umbrella that we use is Isaiah. I have a testimony, and every time I think about it, it's scary, and up on today's day, it still hurts me. Sometimes, during the spring and summer of 2008, my mother lives in New Jersey. She had to go through some surgery, and the thing about it, I couldn't be there. I have just seen her December 2017 during the Christmas holiday, and I have used up all my vacation time. I had nothing left. And my dad called me and told me, hey, your mother's going through surgery, and this is the first time I've ever had the fear of losing somebody. And my mother's pretty healthy for the length of time that I've known her that she lived on this earth. And it became something very frightening. You know, it put me in a state of mental instability, knowing that you had to go to work and at the same time think about your mother going through surgery. Very painful, very hurtful, very scary. But I had to go through that moment because I couldn't take time off to go to New Jersey and see her and be there with her. And at the time, my dad was in a fragile state. He couldn't handle the situation. He much older than my mom. It's kind of a scary situation, but I had to go through that. But the question that I keep asking myself, when does it become important when you can separate yourself from your vacation time and your family time? And that question has dawned on me for the longest. And up until this, it's the guess to me that I don't even have time for myself. And the time that I have for myself to take away from work and relax and refresh and regroup, I have to use that time to go see family members, especially my mom. Right now, my brother, he's locked up in New Jersey. I don't even have time left to go and see him. You know, family paid leave is just not an individual thing, Mr. Chair. It's for every family that is involved in this room. It's a Minnesota thing. So I hope this body consider that and take into consideration we all our brother's keeper. Thank you.
Thank you. Nikki Jones?
Mr. Chair and committee members, I'm Nikki Jones, and I'm a small business owner in St. Paul, and I'm here to support the paid family and medical leave insurance bill. My partner and I own and run a martial arts school in St. Paul. We are the primary and sometimes the only instructors in every class. We're there physically teaching 6 days a week, year-round. If one or both of us were injured or became seriously ill for an extended period, the chances are good that we would have to close a school that's been in business for over 13 years. We would lose our livelihood, and the Midway neighborhood would lose a business with a strong community focus and a mission to make what we teach available to anyone, regardless of their ability to pay. I want to express appreciation for the author's ongoing efforts to make this bill work for small businesses. One of the recent changes would mean that a business like ours would be able to pay just the employer's half of the tax. For those of you who don't own small businesses, the consistent double taxation of self-employed folks is a big part of the financial burden of owning a small business. And the bill is now even better for self-employed people like me who choose to opt in. And finally, I want to be clear that I support this bill even if it never directly benefits me. Paid leave is a benefit to my community that ensures that every worker has a financial safety net when they have or adopt a child, when they need to take time off work to protect their own safety, or in the event of a serious medical condition for themselves or for a family member. No one in my community should have to choose between their health, their families, or their safety and their job. I encourage the committee members to support paid family and medical leave insurance. Thank you very much.
Thank you. I hope you never have to use it. Jones. Lauren, oh, I'm going to murder this one again, too. Wow. Oh, it's you.
You've heard it a couple times by now.
We have. I'm just terrible with names and last names particularly. So please identify yourself for the tape and me, and I'll try to remember it next time.
Good evening, Mr. Chair, members of the committee. My name is Lauren Schotthorst, and I serve as the Director of Labor and Management Policy for the Minnesota Chamber of Commerce. The Minnesota Chamber represents 2,300 businesses of all sizes that employ more than 500,000 employees in every industry across the state. In the interest of time, there are a few documents in your packets that I would like to draw your attention to that outline our concerns with House File 5. In addition to the Chamber, I am also speaking today on behalf of a few coalitions that have united against the one-size-fits-all statewide workplace mandates before the committee this evening. The Minnesota Chamber Federation is a partnership with 43 local chambers representing over 21,000 businesses. The Minnesota Manufacturers Coalition represents a wide range of individual manufacturing associations across the state. And finally, the United for Jobs Coalition represents nearly 80 organizations and their hundreds of thousands of employees. As you can see from the list on hand, these organizations represent every industry in every part of our state. Our members and partners have significant concerns with the impacts these proposals will have on employers, employees, their ability to serve customers, make products, and operate efficiently and successfully in Minnesota. We want to emphasize to the committee, as we have in previous hearings, that our members support their employees at work and at home. They understand the pressures employees face with caring for themselves and family members, and they work hard to accommodate those needs. House File 5 disrupts benefit offerings by imposing a state-defined, state-mandated benefit with high costs to the workforce and to the state. The fiscal note shows that an entirely new state claims-based system would need to be created, that general fund dollars would need to start up the costs, that new payroll taxes on employers would have to be imposed, and that the number of employees potentially taking advantage of the leave wage replacement is not well known. There are many assumptions that the fiscal note relies on that would impose considerable costs to the state, employers, and employees, some of whom may not have the need to use the leave benefit. We appreciate the intent of the proposal, as many employers have stepped up to meet the family needs of their employees through various paid leave benefits. However, the Chamber and our partners remain opposed to the bill. Thank you, Mr. Chair, for the opportunity to share and highlight these concerns with your committee.
Thank you, and I apologize for slaughtering your name. Joe Larson from Minnesota Business Partnership.
Thank you, Mr. Chairman. I've got an easier name. Mr. Chairman, members, I am Jill Larson with the Minnesota Business Partnership. I want to echo the comments that were made by the previous witness. We do support the goal of this proposal. We understand the need. Many of our members provide very generous paid leave benefits. Our concerns are with some of the scope, the implementation details, and the funding mechanism in this proposal. The fiscal note does go into a level of detail, but in many places it does say that it's speculative, that they're making assumptions, and so we're concerned that the costs may be much more than what are laid out in the fiscal note. This proposal is much more than just a wage replacement for people that take family medical leave, which we think that might be a more appropriate approach. it is to do some sort of a wage replacement on a voluntary basis. This is a new mandate on every employer in the state, both public and private, for 24 weeks of paid leave. It is much more expansive than most of the other states that have a program like this in place in terms of the benefit level, who's eligible, and the funding mechanism. And our other concern is that it's going to be very difficult for an employer to have their own private plan under this system because of the way that the requirements are laid out in the bill. And so for employers that want to provide the benefit to their employee, it's going to be very difficult to do so. And this is a new tax on employers. It's about $1 billion a year new tax on employers. I understand that it can be shared equally with the employees, but no other state that has a program like this taxes only the employer on the paid family leave portion. In fact, most of the states tax the employee. And because of the unknown costs, we're concerned that the tax rate that's in the bill has a strong potential to increase substantially over time, and that's just another increased tax burden on both employers and employees. Thank you, Mr. Chairman.
Thank you, Ms. Larson. Mike Hickey.
Mr. Chairman, members, Mike Hickey with the National Federation of Independent Business. The names, I think, are getting easier to pronounce here as we progress through the agenda. You know mine. Wanted to share a few comments with this about the bill. As many of you know, NFIB is the major small business group in the state. And we're very concerned about the road you're going down tonight. I realize they've got a couple bills that are going to provide new mandates, and I guess our concern is after this, where do we go beyond this? But we're just concerned about the state rolling out a long list of mandates on employers, especially small employers who are taking big risks to try to start an enterprise and having to deal with all that on day one of trying to start a business. As you know, the failure rate in small businesses are very high. The assessments range from 30% in the first 2 years to 50% in the first year to a very dark one from SBA of two-thirds failing in the first 10 years. So there's a lot of energy and entrepreneurial desire going on there, but also really high failure rates. And people aren't going to do this if the list gets longer and longer and the costs are imposed on people who don't know if they're even going to be around 6 months after they turn that key, maybe sitting in a 1 or 2 room business with 1 or 2 employees as they try to launch this small business experience. We're concerned about the assessment rates growing in the future. I'm glad I heard the commissioner's comments. This is a very expensive endeavor, and it's going to take a lot of money to start it up, but we're concerned about these assessments growing in the future. I suspect a lot of employers will ask their employees to pay half, and ironically, in most of the states that have done this, it started off with being just an employee contribution, and these are pretty liberal blue places, and more recent states have done a split contribution, like I think this one will end up in most cases. Finally, a lot of states have had a small business exemption for the very smallest businesses. The concerns I just shared, the under 10, the under 20, even under 50, and we're not doing that here. So we're gonna put this burden on people to add this to the list of things they need to worry about in the very beginning of that business. And finally, we're also concerned about for workers that utilize a significant part of the leave or the whole leave of having to find a replacement for them and then dealing with potential unemployment ramifications when that incumbent worker does come back. And that will happen. I realize thinking about a subsidy provision to try to help some of the small businesses in that situation, but that's not going to cover everyone, and that is going to happen if people utilize most of the leave or all of the leave. So big challenge here, big price tag, big endeavor, and just wanted to share our thoughts.
Thank you. And Kim Lewis.
Good evening,
Welcome to the
Mr. Chair, committee. My name is Kim Lewis, and I'm with the Minnesota School Boards Association. We represent 332 school districts across Minnesota, and we have had the opportunity to meet with Representative Halverson on her bill just recently, and she was very gracious with her time and explaining the bill in more depth to us. As school districts, we are faced with a great funding crisis of our own and keeping our schools fully funded. We've straddled with some funding issues over the years, and this is not another new entree for us. We look forward to, she's offered very graciously to continue discussions with us, and we wanted to bring in our HR representatives and see where this would take and how it would play out for school districts. As you know, we're state funded. We don't have a way of really understanding the total mechanisms yet and the depth that it might take. So we're looking forward to continuing discussions with her and our HR group and see where that takes. So we look at in the very near future.
Thank you.
Thank you.
That's the end of the testifiers that have signed up. This is a finance committee, and we've strayed pretty far from finance. So I will ask anyone that would care to comment on the bill, plus or minus, to come on down right now, but I would admonish you to try to stay towards the finance if you can. Going once, going twice. I'm going to open it up for questions. So are there any, well, before I do that, Representative Haley, did you want to offer your amendment?
I can do that before or after questions, Mr. Chair.
Why don't we do that before and put that out of, get that out of the way, so to speak. Do you care to move your amendment?
Yes, I would like to move the DE1 amendment, Mr. Chair.
And the DE1 amendment is on the table. Would you care to explain your amendment?
Certainly, thank you, Mr. Chair. And thank you, Representative Halverson. You and I share a lot of interest in some of the same issues facing our state, and also to you, Commissioner. I've spent a lot of time with your staff and getting to know you, and we also share interest in job creation. However, on this bill, I do have serious concerns. So I appreciate you listening to those. So my DE amendment allows us to really tap the brakes and take a step back before committing the state to a program that I believe will raise taxes on employers and employees to the tune of $1 billion a year, and will also require us to build a new IT system from scratch in a very short time frame that the department has said they cannot do on their own. If we have learned one thing lately from the state of Minnesota through MNsures and MNLARS, it is this: do not rush a big IT project. My amendment brings together a group of representatives and stakeholders. It gives everyone a year to sit down, to hear from policy experts, from qualified actuaries. Normally, when you build an insurance program, actuarial analysis is a very big component, to include input from employment experts and people who will be able to model out this program. The task force will listen to employees and employers to see what they actually need in a paid family leave program, and will be able to answer some of the questions that the agencies cannot answer right now and fill in the fiscal note. In reading the fiscal note, I happen to notice there is at least 15 distinct instances in which the agency responsible for producing it says, to quote, "The impact is indeterminate," or another quote, "The number is unknown," or "We have no way of estimating," or "Absent of data, we are estimating." Over and over again in the fiscal note, we have questions on how this will be built, how it will be paid for, and how it will be run. The fiscal note also says that paid family medical leave is much more complex than UI. So that is very concerning to me. These are not inconsequential things that the agency doesn't know. They have admitted that they don't know how many employers will opt out, how many employees will use the benefits, or how this could change the impact on public programs. One glaring example of this is on page 8 of the fiscal note, where Deed is quoted. "We have no way of estimating the number of employers who will be eligible to opt out of the program, absent any modeling or analysis about the impact this bill may have on Minnesota's employer behavior. We have thus chosen to assume that Minnesota employers will not opt out of the system." Respectfully, Chair Halverson, I just don't think this is ready for prime time. I think it's irresponsible for us to continue to pursue it without better data. I think we need to take the time to make a more data-informed decision before we plunge headfirst into a sweeping new program that has all the indications that it will cost us more and it could be ripe to be the next MNLARS or MNsure as it rolls out. With that, I ask for your support on the amendment, and if you would like me to talk through the description in detail, I can do that as well, Mr. Chair.
Thank you, Representative Haley. If you cared to be more specific about your amendment, that's fine with me. Otherwise, we'll go to the author of the bill to see what they particularly would like. I have just read the amendment, or I glanced at it earlier. Essentially, you're creating a task force with how many members? 15 voting members to spend a year or so, see if there's a better model.
Yes, Mr. Chair, it is pretty self-explanatory. I think you summarized it well.
Representative
Yep,
Halverson.
Thank you, Mr. Chair, and thank you, Representative Haley. I always think that you are very thoughtful in the way that you approach legislation, and always enjoy working with you. However, I do oppose this amendment, and I will tell you why. One of our chief struggles around here at the legislature is admiring problems. We spend a lot of time admiring problems. The need for this legislation has been made crystal clear, and I think that it was really emphasized with the testimony that we heard tonight. Employers are asking for this, employees are asking for it, and it would be a great financial benefit to our state to do this work. And we know that not because we're guessing, we know it because it's been studied. It's been studied by the state of Minnesota because in 2015, the state of Minnesota provided funding for a study at the University of Minnesota, not to see if we should do paid family leave, but to see how we do it, because we skipped the if, because the need had already been clearly demonstrated. So the dollars were allocated and the study was done, and that research is here. In addition, nationally, we have looked at everybody across the world. Here's just a handful of studies on why and how paid family leave is important. And then we also have information with regard to other states. And the analysis, I walked through the analysis very thoroughly with the agency in the last several weeks, and we've spent a lot of time doing this. We know a lot. There are not a ton of unknowns because other states have done this. And is there cautious language in the fiscal note? Of course. We want to be sure that we understand that these are people. And we know that uptake will be different. But in general, you look across the board at modeling, we know that Minnesotans are leaving about $839 million in wages on the table when they take leave. That's what's on the table right now. That's money that is not going into people's pockets and back into the economy. We know that people are leaving the workforce, that people are getting sicker, that babies are sicker. There's a lot of cost to not doing this. And these are things we know. We know it conclusively. And so to say we need to study this further, I think to get out your bingo card, it kicks the can down the road. We can lead on this in Minnesota because we have the data to back us up, and we have the state infrastructure that has been working successfully that we've modeled this program on, UI, to administer this benefit. And, yes, there have been hiccups with programs that the state have built, but the state builds programs every single day. And there's a lot that we don't hear about. They're not in the news because they work. And so I would say please oppose this bill. I think that we're beyond studying the problem. I think it's time for Minnesota to take some action.
Is there any other comment on the amendment? Representative Kosnick.
Thank you, Mr. Chair, and Representative Haley, I appreciate the amendment, and I support it. Representative Halverson, I know you've done a lot of work on this bill, and you've taken a long ways, and I recognize that it's not if or how or why we should be doing this. Some of us have reservations on maybe the why. But I think what the amendment addresses is how are we going to do this efficiently and then not have a train wreck in 2 years here. And so I think that's an important reason to just tap the brakes and make sure that we do have a lot of the assumptions answered. The fiscal note says multiple times, over I think 15 times, that you don't have the data on the specific topic, and you're kind of guessing on how many people will use the product. And so I think that's an important reason, not necessarily to further study of the issue, but how you're going to implement it. And I think that's what the amendment and the task force does, is gives the legislature more time to make sure that the assumptions that are used in here are accurate, and so businesses can know and employees can know how much they may be, the premiums will be, to make sure they're well thought out, and how many people will use it, and how it will impact our economy and jobs going forward in Minnesota families. So I think it's important opportunity for us to sit here and not just dive into the deep end and hope for the best. Additionally, I'm not sure how much traction you're getting across the street with this bill. This might be a good opportunity for you to get something better than nothing.
Representative Kegel.
Thank you, Mr. Chair. And, I hear some fear about moving forward. And I think, yeah, some of these big lifts are kind of scary, but our constituents send us here to do the hard work. And our constituents can't afford to wait and kick the can down the road. And so I really think that, we need to get on with the hard work and actually do this. So I would also oppose the amendment. Thank you.
Seeing no other questions, I will give Representative Haley the last word.
Thank you, Mr. Chair. I guess to paraphrase Representative Koznick and the comment, it's not kicking the can down the road. It is significant concern, as we stated. How will this be implemented? And do we understand enough how that's going to work so that we can do it right and do it well, and not face a train wreck that like we have with other programs? I have many additional questions on the fiscal note, but we can deal with the amendment and then get on to those.
All those in favor of the DE1 amendment signify by saying aye.
Aye.
All those opposed signify by saying nay. Nay. I think the chair's ear is good enough to say that failed. So,
Mr. Chair.
I don't-
Mr. Chair. May I just remind the committee that if you voted for the jobs bill in 2015, you voted for the study. The work has actually been done. We financed it, studied it, and so mission accomplished.
Thank you. Thank you. I'm going to open it up to committee questions. I was trying to get this thing done so we could get to the freshman party, but I don't think that's going to happen tonight. So I'm going to be, please keep your questions to the fiscal end of this rather than the policy, because we are a fiscal committee. And this bill has been heard in several committees, policy and other policy and finance committees, and it's got another committee to go to. And we have 2 other bills to do this evening. So with that being said, Representative Hassan.
Thank you, Mr. Chair. I see you're struggling with last names tonight.
I am.
I want to thank the author of the bill. This is really needed. I remember door knocking in 2018, and one of the constituencies that I talked to said only one thing that she cares about is paid family leave. And she told me a very emotional story about how she had to leave the workforce because of a sick child. So I thank you for that. I just have a quick question about how does this impact individual contracted workers? Like, I know Amazon has a lot of drivers that don't have, they work for Amazon, but they're considered individual contractors. So how does that impact?
Representative Halverson.
Mr. Chair and Representative Hassan, in the bill reflects all of the ways that statute currently treats independent contractors, and so from the 9-point test that is used in construction to the anybody who is identified in current state statute as an independent contractor are treated the same way in this bill. The difference is that any independent contractor or anybody who considers themselves to be self-employed can opt in, pay a premium, and get the benefit, which is different than a lot of other types of benefit programs.
Representative Hassan.
Thank you, Mr. Chair. I want to say on the record that I do support the bill, and I think it's a good bill. Minnesotans have been waiting for this, and I don't think we should wait. So thank you for bringing this bill to us.
Representative Koznick.
Didn't know I was on the list, but I do have some questions. Thank you.
We just knew.
You're that good.
Your hearing and your intuition is very good tonight. To the Commissioner, you're back at the testifier table. When we talked earlier a little bit going over the governor's budget, you'd allocated a certain amount of money to start building this out, 58 million, or 50 or 60, I don't remember the exact amount. But I know you have an IT background, and we're pretty optimistic, in my opinion, that something like this could be built out in 2 years. Just kind of your testimony earlier, that was your testimony earlier in committee, but this year, but from walking through the fiscal note earlier tonight, it looks like it's going to be 4 years to build out. What is your confidence level? Is that more accurate, that it'll take 4 years or 2 years now?
Commissioner.
Mr. Representative, the IT build has two phases to it, like I said before, both to build the benefits collection system and then to build a payment system. The reason that it's not just 2 years and we walk away is that obviously once you've built something, you need to iterate and develop feature sets as you go. And so we've built a longer timeline for that on the advice of Minute, and that's the advice that we're taking as we build out that estimate. So it is not just a 2-year program to be done and walk away from it. It is a longer build, but the timeline as stated here and the cost associated with it would put us in a place to deliver on the program in 2 years, with the IT build continuing for an additional few years before we transition to fully staffing it with Minute staff versus contractors we would bring in.
One other question, then we're going to move on to the next one. Next person.
All righty.
We'll do 2 at a time, and then we'll come back to people.
Well, I think that's interesting, and that's part of our concern, as we talked about the amendment earlier, a lot, and the fiscal note talks about some of the assumptions and uncertainties and not having data on some of that. But it does make a comparison to the unemployment insurance, which was a much simpler system according to the fiscal note. And it took 5 years to build that, and the fiscal note said this is a much more complex, and we're allowing 4 years to build it. So I think there's a problem with the assumption, and I think if we were to go forward with this, we would have some problems rolling that out, and we'd be, unfortunately, in the same pattern of Min-Lars and Minsure, and I'll leave it at that.
Representative Haley.
Well, thank you, Mr. Chair. Surprised to be next so soon. And this might be for the Commissioner. I'm trying to kind of wrap my head around the uptake rate and then how many total employees and employers may do this. So again, going back to the fiscal note, looks like around 4% for health, 1% for pregnancy, 0.5 for bonding, et cetera. So if there are about 3 million total Minnesota employees, and then an estimated number of almost 200,000 leaves annually, what percentage of Minnesota employees do you think would use the program? How big is the universe?
Well, okay, Mr. Chair, Representative, if you look, so you're looking at page 9 of the fiscal note, right? Mm-hmm. And just to understand your line of questioning, you're looking at the percentages that we estimate of take-up per qualifying instance.
Correct.
As a percentage of the population. And your question is, what would be the total amount of claims? Because we went through that before, and as I said, it's about $780 million. Are you wondering how many people that equals, or are you?
The percentage of Minnesota employees that would be using the leave, any form of the leave.
Mr. Chair. Siri wanted
Maybe
to answer.
Siri's going to answer that.
She never gets leave.
Mr. Chair,
Maybe to move things along.
I can answer the question.
Okay, go ahead.
I can answer what an estimate can be in Minnesota based on other states' experiences. Currently, we have nearly 400,000 people in Minnesota who take an unpaid leave or some type of a leave. That is a significant number. And so I think one of the myths about this bill is that it's going to create a pipeline for people to leave work. That's already happening. The leave is happening. They're just leaving almost, $4 million on the table. And so when you've got almost 400,000 people a year taking leave, what other states have seen is that paid family leave doesn't make it possible for more people to actually take the leave or take a longer leave. And so the uptake increases about 6%. And so in Minnesota, that's a little over 21,000 people. In addition to the 400,000 that are already currently taking leave. So it's not a stampede out the door. You do have to have a qualifying health condition and has to be approved through an application process. And I think that the other thing to remember is Minnesotans work hard and Minnesotans show up and they get their jobs done. And so it speaks a lot, I think, to the work of Minnesotans.
Mr. Chair, can I ask a follow-up? Thank you very much. Thank you, Representative Halverson, and I agree with the numbers there, so 6% approximately. So my point in asking you that, and to the Commissioner too, is that I'm concerned, again, this is very expensive. It's more expansive than any other state has done for 6% of employees that want this type of leave. Is it really necessary to do a mandatory payroll tax on every employee and every employer in the state? Or is there another way, and this is rhetorical, that we can provide this option? Again, 6%, and you agreed with me, 6%, we're doing $1 billion program.
Mr. Chair.
Thank you.
Representative Halverson.
Mr. Chair and Representative Haley, it's not 6% of people who are going to take a paid leave. We're looking at over 400,000 people who are going to get paid leave. The increase in terms of the number of people who take leave is simply 6%. What we're doing is replacing wages for people who are taking leave and not getting a paycheck, taking leave and having to rely on public programs. Taking leave, taking an ineffective amount of leave, ignoring doctor's orders to stay on bed rest, to be at work. Those are the people that we're talking about. So we're not talking about 6% of 400,000 people that we're doing this bill for. We're doing it for all the Minnesotans who have some type of accident, injury, illness, or need to care for somebody else.
Representative Robbins.
Thank you, Mr. Chair. Thank you, Representative and Commissioner. I heard this bill last in Judiciary, and at that point, the cost was being split between the employer and the employee, and it appears by the amendment tonight that now the employer will pay the entire tax, and they can choose to have the employee pay part of that. Am I just understanding the amendment correctly?
Mr. Chair and Representative Robinson, that has always been the policy in the bill. The intention has always been to provide an opportunity for a shared input into the bill. The mechanism to collect the premium is through the employer, and much like other benefits that the employer charges back the employee for, like Social Security, other payroll taxes, it's treated the same way. So it's always, the policy has always been that way in the bill. It's showing up now as an actual premium number.
Okay, and
Representative Robbins.
sorry, Mr. Chair. Thank you, Representative. Going back to the independent contractor issue, again, I don't recall that from the last time I heard the bill, and if they are paying just half of the 0.65%, wouldn't there be a quite significant incentive for employers to switch to using more independent contractors or switching their own business model to become an independent contractor? And if that in fact is the case, how would that affect the finances of the program?
Representative Halverson.
Mr. Chair and Representative Robinson, I think you're going to hear another bill tonight about misclassifying workers. The law is very clear on how to classify workers, and so any business that has been built with a classification of workers as employees or a classification of independent contractors, those classifications are all reflected currently in the bill. So everybody is treated as they are today.
Okay, and finally, Mr. Chair?
One more, yep.
Okay, thank you. Going back again to, well, I have two questions, but I'll make it short. The commissioner seems to have a lot of discretion if the assumptions are wrong and the 0.65% is not adequate to fund the bill, the commissioner can raise the tax to anything he deems necessary to keep the fund solvent. That seems, given the sort of rosy scenario, the assumption seems to imply that, is there any review where the legislature weighs in, or there's any other chance to review the model or the benefits? It seems like a great opportunity, a great amount of authority for an unelected official to raise taxes on every business in the state with the scenario we have in place.
I have a sneaky suspicion that it doesn't matter how long if this bill passes, we'll be revisiting this bill every year for the next 20 years. Representative Halverson, would you like to comment on that? Not mine, but Representative
May
Robinson.
that not be so. I think you raise a good point, Representative, and I certainly would be open to thinking about assurances that can be put in the bill. I dispute that the scenario that's painted as rosy. It's very well thought out. One of the conversations that we had recently that, if I may repeat it, was when you're talking to actuaries, you're talking to folks who know their numbers. They're some of my favorite people in the world. But it's so funny how much our gut drives this policy. Like, we keep thinking about, what does this mean in my life, and how does this feel? How does this feel to us? And the pushback was, we actually have the numbers. We don't need our guts. And so this is not a scenario that is in any way painted to be particularly optimistic or unrealistic. This is a very realistic and very deeply studied model. So I don't know if the commissioner wants to comment further.
No, we're going to go to the
Okay.
next question. Representative Dabney.
Thank you, Mr. Chair and Commissioner. I'm intrigued with a number of aspects of this, and I'm appreciative. I got my highlighter out. On page 7 of the fiscal note, you talk there about premium collection and benefit payments, and that Washington and Massachusetts have similar family and medical leave programs, and that you might look to contract with a vendor familiar with those programs. That seems prudent because from what I understand, these things are complicated. And having somebody who's done it and done it successfully makes sense. So thank you for that. I'm interested in what may be understood about the gender or age demographics on uptake, because I could see it from my own lived experience being different across the age span and being different between genders. And I don't know if you or anyone else has information about that.
Mr. Representative, Deb here, who wrote the study that the representative put up on the table a moment ago, might have some thoughts to share on this.
Mr. Chair, members of the committee, I will be brief. Yes, there is a gender
Identify
dimension.
yourself for the tape.
Oh, sorry. Deborah Fitzpatrick, co-direct the Center on Women, Gender, and Public Policy at the University of Minnesota. Women do tend to use the program more, although men are increasing their uptake, and actually pay is an important element of getting more men to be involved in bonding leave and caregiving leaves, and California has shown that to be the case.
Mr. Chair, if the testifier could, I caught the gender piece. I'm not surprised. I caught it. What about age? Is there I think back to when my wife and I were in those childbearing years and watching women friends move generally from small employers to larger employers as they looked ahead to wanting to start a family. So you think about the small employers who've invested in training those employees and then lost them because they didn't provide a benefit package that supported the employee and their family. And then I think about my wife today, who is a self-employed consultant, and a number of our friends again, but my wife, who has an 82-year-old mother with Parkinson's, who had brain surgery a year and a half ago, and what our family's needs may be going forward. So I'm wondering, is there kind of a bimodal distribution on age? How does that play out?
Yes, Mr. Chairman, members of the committee, it does vary by type of leave, as you're kind of highlighting, right? Medical leave is more equal, although 25% of medical leaves are taken for pregnancy-related complications, so that drives the averages to be more gendered and more younger. On the other hand, more older people have disabilities and other medical conditions that will require them to take a leave, so it does vary by the type of leave. And on the family leave part, obviously the bonding leaves are going to skew towards younger workers, but the family care leaves can tend to skew towards the older workers. So it really does depend exactly on which part of the program you're talking about. But in general, it's, it works out across the life spectrum that people are taking advantage of it.
Mr. Chair, just briefly, thank you. I think the illustration is that life happens. And I'm reminded when I was teaching and union president, we had a couple, both of whom were teachers in the district, well-liked, well-respected, and who adopted the first of their two children from orphanage in Eastern Europe. And luckily for them, we were in a contract negotiating year. Luckily, they were respected and liked in the district, and we were able to negotiate a gender-neutral family leave into that union contract. And the tendency in Eastern European orphanages is it's 100% female staff. And so the son they adopted had almost no experience with male caregivers. And he was kind of that toddler, preschooler age. And so they made the choice there to have the dad stay home and take advantage of the leave so that he could bond and so that the boy could have an opportunity to bond with a male parent figure because he'd never had a male caregiving figure. So you shouldn't have to work for a place that has negotiated that to get the best deal out for your child and your family. Thank you, Mr. Chair.
Thank you. Representative Zahn.
Thank you, Mr. Chair, and to Representative Halverson, thank you for bringing this bill forward. I think I sat through two committees where you actually brought your bill, and I've heard a lot of good intentions of this bill. And as I'm sitting here, over the weekend I had a family event where a relative was very sick, and we had a spiritual, as you know, in the Hmong community, sometimes wellness is also spiritual, and we had a family ceremony, a shamanism event, and I'm just wondering, would that be covered under this bill? If there was, for example, like I have family members who practice shamanism, and they want to take time off to do a ceremony for a healing process for the family members?
Representative Halverson.
Mr. Chair, Representative Zhang, that's a really interesting question. I'll tell you the parameters for taking leave, and you can tell me if it fits. But this is meant to be different than short-term leave or short-term time off. A lot of people call it PTO. That's the way it's calculated. This is meant for long-term events that last longer than 7 days and that are medically necessary. So I don't have anything in the bill on that. If I think that culturally appropriate medicine should always be available to people. So if you think there's a hole, you can let me know. But I'm not sure if that is meant to cover what you're talking about. You can advise me.
All right, thank you, Mr. Chair. I guess I'll chat with you more often.
Okay, I'd appreciate that. Thank you, sir.
Representative Noor. Thank you, Mr. Chair, Representative Halverson. Thank you so much for bringing this bill. I know that there are several issues that we've already talked about, but this brings an opportunity for folks who want to take care of their kids and their family and their parents. And I've heard a lot about the systems today. And in many places I've heard about the systems, and the commissioner, have we had any problem with the Workforce One? Or have we had any problem with Maxis or MEC Square or the other programs that were designed actually by the state? If you can give a comment, are we going to be creating something new? Because we already have the UI system, which is functioning very well. Could you comment on that issue of IT crisis, which I think sometimes becomes more manufactured without knowing the details how the IT system works? Representative or Commissioner, would you like to take that one?
Sure, Mr. Chair, Representative. It's an important question. We are modeling the IT build off of Deed's experience in building IT solutions for programs, and UI is by far the most relevant program to measure against, and that system has worked very well over a number of decades. It is actually nationally looked at as a shining example of a great IT program for a benefits payment system. And so at Deed, we feel like that expertise over time will help us with building a new system. But again, the reason we can't just use that existing system for this program is that that is a federal program. It has unique federal funding and feature sets for UI that don't apply to this program, and so a new build would be required.
Mr. Chair, I appreciate that. And knowing that this is a very important program for many constituents that I have, and they've come to me, they've talked about it, and I would like to ask for a roll call, if that is appropriate, Mr. Chair. Sir? Was there a question in there or comment? It's a comment. Representative Cosney.
Thank you, sir. Representative Halverson, you know, I have two young daughters. They're growing every day. They're not babies. I made it through that stage, and it's a blessing, but it's also a challenge, and I recognize that, and I appreciate that your bill is attempting to alleviate some of those challenges. I really do. But I'm not sure that this is, we're taking away some of the free market opportunities and for people to realize full potential, and hurting people that are trying to realize and create their own dreams and businesses by doing this a little bit. What I don't see in the bill is how this bill helps raise that child farther down the road, you know, for that short-term time, which I do think is important. But long-term, the parents, father and mother, need to be there for the child. One of the, you know, we talked a little bit about employers that are offering pretty nice benefits already. It's kind of forcing them to give up on those programs that they've started and the contracts that they've made with their employees and forcing them onto this system. And I think that's something that's a little bit overlooked, and we may come to regret. One of the, you know, some of the businesses and organizations that have the most employees are our local governments, our schools, and this is passing on a huge burden to them. And I'm not sure how, you know, as we fund our schools, how do we now also accommodate for that without damaging funds and resources to go into our classrooms?
Mr. Chair?
I didn't hear a question in there, did you?
I heard a question about employers, and I think it's important that we recognize there's a significant portion of the bill that's dedicated to employers creating their own self-funded plans. And the procedure is that they apply to Deed and pay a nominal fee once, unless their benefits are reduced in the future, and then they reapply. And they can provide their own plans. Not only that, but they could choose to participate in the family leave portion and continue their own medical leave. leaving the short-term disability, the option to purchase short-term disability plans available to employers. So the notion that it's one size fits all and that it's a harsh mandate that everybody has to participate in, employers get to make their choices. And that's true in other states as well. And I've talked to employers who are actually operating in a number of states that are already producing these paid family leave programs. And large employers, in fact, one of them even said to me, we know how to do this, we know how to make it work, because we do it in all these other states. Not only that, but they're operating globally. Because the United States is the only state in the country other than Papua New Guinea that does not have a paid family medical leave, our Fortune 500 employers, of which Minnesota is a leader in the nation, operate in communities that have these policies. And our bill gives them the option to make a choice in how they want to participate in paid family and medical leave.
Representative Robbins will be the last, and then we're going to vote on this.
Thank you, sir. I'll be quick. Back to the discussion about how this affects state, county, and local governments. I didn't find in the fiscal note like how much this is going to cost and how they are paying for it. Is it expected that they'll raise property taxes? Is it expected they'll come to the state for additional money to cover this cost? Could you just talk about that? Thank you.
Representative Halverson.
Mr. Chair and Representative Robinson, it would work very much like it would in the private sector. There are a number of local and county governments that have short-term disability policies in place, that have other types of leave in place that would be comparable. So they would go through the same process of saying, we want to opt into the state program or we want to create our own program. And so it would be the same process. So they're already, most local governments are paying for some type of medical leave already. So they could adapt their own program or join the state. It would be up to them. So it wouldn't be something that would be completely new out of whole cloth.
Thank you, sir. So, but basically that's currently paid through taxes. So this would be paid through more taxes at the property tax rate or something like that?
Mr. Chair and Representative Robbins, there is not analysis that says that it's going to be greater or lesser. So to say that there's going to be an increase in the need for property taxes, it may be a decrease. It would be a city by city, county by county basis.
Thank you. And the schools, would they be exempted or would they get additional revenue from the general fund?
Mr. Chair and Representative Robinson, I think that's a very good question. I actually have time on my calendar to sit down with Representative Davney to have that exact conversation. There is no intention to carve out any classification of employees. We know that people need this because, as so many people have demonstrated, life really does happen. Not putting money in your pocket means we're not putting money into the economy. We're keeping people out of the job market, and the same is true in our schools. And there are people at all wage levels who are participating in our school workforces, and so there's no intention to carve anybody out.
Thank you.
There, no more questions. We're going to move to a vote. I will move House File 5 as amended to Ways and Means with a recommendation for state government finance. The clerk will you take the roll? I think you're the clerk, but I'm not sure. Chair Mahoney. Yes. Representative Newer.
Yes.
Representative Gunther.
Pass.
Representative Backer. Representative Claflin.
Yes.
Representative Davney. Representative Eklund. Representative Haley.
No.
Representative Hassan.
Yes.
Representative Cagle.
Yes.
Representative Kosnick.
No.
Representative Meckland.
No.
Representative Moran. Representative Robbins.
No.
Representative Stevenson.
Yes.
Representative Sundin.
Yes.
Representative Zhang.
Yes.
Representative Gunther.
No.
You are on your way with an 8 to 5.
Thank you, Mr. Chair and members.
Thank you. You missed. Too late. Representative Lesch is next.
Get started and then you can lay down there. Is it laid out? Oh, this one. Good to know.
Do I have to,
We don't need them for the number, though.
Yep.
yeah.
Pardon?
What's the amendment?
We have other business to attend tonight, and if you have conversations, please take them out into the hall. Welcome to the committee, Representative Lesch.
Thank you, Mr. Chair.
You have House File 11 tonight. Where do you need that to go? Ways and Means?
Yes, Mr. Chair. Ways and
So I will move your House File 11 to be, be referred to Ways and Means.
Thank you, Mr. Chair, and I have an A7 amendment I'd like to incorporate. I also have a technical oral amendment to my author's amendment, if you'll entertain that.
Hold on just a moment. Did you have something that you needed, Representative?
Yeah, Mr. Chair, we're just discussing, looking at this bill, there's a pretty big cost to MMD, and so I was wondering if a better referral would be to State Gov.
Actually, I don't think we can refer anybody, any of these bills out. We have to refer them back to Ways and Means, and then they would refer them out. And I did not make any recommendation where it should go after Ways and Means. So it's going to go back to Ways and Means.
Thank you, understood.
So I will move House File 11. You have an amendment?
I do, Mr. Chair. It should be in your packet. It's the A7.
A7?
Yes.
I will move the A7 amendment.
Thank you. And the proposed technical oral amendment to the A7 amendment, Mr. Chair, would be to delete "or similar entity" on line 1.4. And on line 1.6, replace the words "section" and "section 177.50." Those words would be replaced with "chapter."
What was the last part of that?
So the first one would be
Similar
delete "or
entity.
similar entity" on line 1.4.
Right.
The second would be on line 1.6, the words "section" and "section 17750" would be replaced with "chapter."
I think that's already in here.
Oh, okay.
At least on mine.
Mr. Chair, Representative Lesch, I think it's just the other way around. I believe it's on 1.6, the word chapter would be replaced with section
That's it.
and section 177.50.
Exactly, Mr. Chair, thank you.
So could you repeat the amendment?
Yes, Mr. Chair, the
No, I'm going to ask staff Oh, to thank repeat you. to make sure that we're clear on this. Sure, Mr. Chair. Line 1.4, delete quote or similar entity, unquote. Line 1.6, delete quote chapter, unquote, and insert quote section and section 177.50, unquote. And what, we will move the oral amendment. All those in favor say aye. Aye. Opposed, same sign. Please explain your amendment.
Thank you, Mr. Chair.
Well, actually, I'm going to start this off a little different. We are a finance committee. We wandered around in the last bill. So Representative Lesch, I'm going to save you a lot of time by not having to go too deep into your bill and to the policy, and we're going to try and stay connected to the finance of your bill.
Thank you. Thank you, Mr. Chair. The amendment itself conforms language from the St. Paul ordinance clarifying the employer when an employment agency is involved. This is at the request of the retailers. It adds language recommended by House Research clarifying how long employers must keep records paired with a specific 3-year statute of limitations. And finally, it restores language from the bill as introduced that was inadvertently removed as part of a previous amendment conforming enforcement to existing statutes. That's what the amendment does.
Thank you. Are there any questions about the amendment? Any questions? Seeing none. All those in favor of the A7 amendment to get the bill in the shape that the author would like, signify by saying aye. Aye. Opposed, same sign. You have the bill in the shape that you would like.
Thank you, Mr. Chair. Mr. Chair and members, House File 11 is before you today because I've carried this bill in one version or another since 2007. It's been an ongoing need for much longer than that because at least when I started, there were 42% of Minnesotans that had no access to sick and safe leave. And this imposed an onerous cost upon businesses and upon the public in general due to several factors, including presenteeism, which when I first started carrying this bill came to about $6 billion a year from your coworkers coming to work and coughing on you, which I saw some of you doing around here when that flu bug went around, okay? Yeah, Mahoney did it too. And gets everyone else sick, okay? And you go to work and get everyone else sick when you can't afford to take a day off. And members, this is far, far more likely if you are a person who takes care of our kids or if you're a food service worker. So if you're a person on the other side of the sneeze guard at Subway coughing in my spinach, and then, you know, we all get the flu from that. So those are the folks who don't have sick days. So this states that you get 1 hour of earned sick leave for every 30 hours that you worked. There's a cap on it, up to 48 per year, and up to 80 at any given time in a given year. It can be thought of a bank of accrued unused sick and safe hours. So without going into all details of what the rest of it does, I will go into the fiscal note because this is the finance component, the reason we're here. The main components of the fiscal note are outreach, education and outreach staff at Dolly to develop trainings and materials to ensure that employers, employees, and HR companies are ready for the start of sick time. Investigators and administrative support staff at Dolly, replacing staffing for state workers in 24/7 facilities related to increased use of sick and safe time. Resources for Dolly's case management system, the Office of Administrative Hearings legal fees, one-time rulemaking costs, and some modest additional revenue from increased penalties. So before I go to testifiers, I would just point out that when we first started carrying this, there was really only one jurisdiction that had passed earned sick and safe leave. We have 3 in Minnesota now, Minneapolis, St. Paul, and Duluth. But at the time, back in 2007, it was just San Francisco. Since then, and some of the testifiers can go into this, and Representative Cagle remembers because she was on board as part of that coalition when we were doing that back in 2007, before she was elected. And everyone was saying this is going to tank all the businesses and it's going to drive the cost of your goods up. It's going to be onerous burdens for employers. In the dozens upon dozens of jurisdictions that have passed this, we haven't seen any of that. And in fact, if you talk to many of the chamber members, they'll say, yeah, you know what, this wasn't that big of a deal. And yes, it does save us the pain in the rear of having the people come to work and cough on our coworkers. The next thing you know, we got our entire design section out with the flu, and it backs up our work several weeks or months. With that, Mr. Chair, I would ask that we go to our testifiers.
Mary Cassidy, Main Street Alliance. All right, maybe she's not here or stepped out. Oh, okay. No. All right, then Amanda Kegel.
Stand nicely, please. Thank you. Mr. Chair and members of the committee, my name is Amanda Kegley. I am from South St. Paul, and I work full-time in a tax department in Inver Grove Heights. We are a Fortune 500 company, and we do not offer earned, safe, and sick time. As you can see, I have my boys with me, so this is very important to me as a busy mom and a full-time worker of a kid at home, too, who plays hockey. So,
Well, wait a second. Are they testifiers?
yes.
So they need to identify themselves for the tape.
Okay. Tell what your name is. What's your name?
Marios.
And what's your name? Come here. What's your name?
Sawyer.
Sawyer and Miles, thank you. As you all know, it's been a very strange winter, extreme cold, and a month of record snow. Frigid temps and bad road conditions caused more school closings than our district and those around us have seen in years. I'm not used to school closings. I grew up in South St. Paul, which I believe Ann also did, but she would know. We never closed school, but school is closing a lot more now. Schools are thinking a lot more about the kids and the buses and the walking and things like that. So schools have been closed a lot more than in the past. I remember there was one week this February where school was canceled Monday through Thursday, and because my kids aren't old enough to be home alone yet, and I don't earn paid sick and safe time. I only get so much PTO. My only choice was to use that last day PTO and take the 3 other days off unpaid. I know I'm not the only parent with school-age children that doesn't have the luxury of paid time off for instances like this, and it puts people in the position to choose if they should stay home and face lost wages or go to work and pay for a childcare alternative that they really just can't afford. Yes, you're cute. I've not only had to take unpaid time off for school closings, but also for days when my kids have been sick and needed to stay home from school. And then when I get sick, I have to go to work and cough on my coworkers because I can't take the days off.
With coughing on your coworkers.
Yeah.
All night long.
When I did get really sick, I got pneumonia and I wasn't able to stay home and get the rest I needed. Because I wasn't able to stay home and get the rest I needed, I had no choice but to stay home at that point. And then I had to take more days unpaid than I would have if I would have been able to just take those few days at the beginning to stay home and get healthy. Good health care and good health is a basic human right, and I should be able to take care of myself and these 2 kiddos without having to worry about missing payments on bills or not being able to put food on the table. I should be able to stay home with my kids on Minnesota snow days without having to pay for childcare that isn't in my budget. That's why I'm asking you to support earned sick and safe time for all Minnesotans. Thank you.
Thank you.
Okay, come on, boys.
Thank you, young men.
They were very patient, so.
Kathy Robley? Good evening.
Mr. Chair and representatives, my name is Kathy Roby. I live in Little Canada and attend Emmanuel Lutheran Church in St. Paul. I'm a leader with Isaiah. I worked with leaders across Isaiah and with our allies to pass the strongest earned and sick time ordinance in the country in St. Paul. And shortly after that earned and sick time was enacted in St. Paul, I noticed that my employer in Arden Hills decided to give this benefit to part-time workers like me, not just the full-time ones. Before this, I received sick leave for only 10 years of my 57 years of employment. I work in the food service industry, so that bit about going to work sick, you can't miss, and you can't go. You're sort of caught. It's a very physically demanding job. I have gone through 2 knee replacements and 2 shoulder surgeries because of the toll this work takes on my body. I fought hard to pass earned sick and safe time, not just for myself, but because all workers deserve the benefit and to be treated with dignity. All workers deserve to work in a caring, family-friendly economy. It's time for our legislators to act with the courage needed to do what is right for all Minnesotans. It's time for us to pass earned sick and safe time statewide. Thank you.
Thank you. Next, Ignatia Ambrose. Did I totally slaughter that one? No. Got it close enough.
Good evening. My name is Ignacia Ambrose, and I live in Bloomington, Minnesota. Obviously, that's why I'm here. And I'm a member of CETUL. And today I'm here to speak about this bill that we need to pass. We really do. As a member of Centro de Trabajadores Unidos en la Lucha, we believe that every single person deserves to be treated with respect, kindness, and justice, simply because we are human beings. This is to say that regardless of where we come from, what language we speak, or how we earn the bread that we eat, we have basic rights that should never be violated. Our communities deserve living wage jobs, a stable paycheck, and a voice at work. Well, unfortunately, that doesn't happen. Many times, it doesn't happen. Too many hardworking Minnesotans are worried about balancing work and family responsibilities. That means people are left behind and forced to make impossible economic choices. As personal, it happens to me. I was a manager at a restaurant in Richfield for 15 years until it closed this year. None of us had sick time, neither myself as a manager or my employees. So we had to make hard decisions of having to work sick or stay home and not getting paid. And really, that for me was really, really hard. As a small restaurant, have the employees come to work knowing that they are sick. I wanted to send them home. They don't want to go home because they need to get paid. They need to pay the bill. So that was really hard on me and them too. We should all be there for our families when they need us the most. At my job right now, I do have it. However, my two daughters, both of them are teachers. Both of them work with kids. One of them does have it, the other doesn't. So when her kids get sick, I'm the one that has to call in and stay home because I do get paid. But if I do that, when I get sick or I need my time, I don't have it anymore because I have to use it for my grandkids. I have to use it for my daughter so she can go to work and pay the bills. So to take ourselves, our loved ones, to take care of them, we shouldn't be limited to geographic, location, or profession. We should all be able to take care of us to pass this bill. So I'm here just to ask you guys to put yourself in our shoes, because I know it might not be affecting any of you because you guys don't make what I make hourly, and you know that. So it's really hard for us to have to go to work and try to work our 40 hours or more if we can. But you get sick. At my age, it's really hard to take care of my grandkids and go to work and know that I only get 5 days that I can go home and get paid. And if I use 5 days to help my daughters, to help my grandkids, I don't get those for myself. So please think of us, put yourself on our shoes, and thank you very much for putting this together. And I'm here to support this bill, not only for myself, not only for my grandkids, so for my community, for all the minority that work on those restaurants, that work on the places. Can you see us working in the back? We prep food every day. I cannot send my employees home because I need them. they don't want to go home. So sometimes we have to work sick, and we have to prepare our food, and everybody's food. Really, it's not right. Thank you for thinking about this, and thank you for putting it together. Thank you so much.
Thank you. Thank you. Next is Adam Hansen. Welcome to the committee. Identify yourself for the tape, please.
Thank you, Mr. Chair and members. My name is Adam Hansen. I'm with the Associated Builders and Contractors. Our contractors and the men and women that they employ across the state are part of the 70% of construction craft professionals that choose to be merit shop individuals. What I want to share with the committee is how this bill disproportionately and arbitrarily allows an exemption to the sick and safe time requirement under the bill that disproportionately affects those construction workers. Under the bill, contractors are allowed to exempt themselves from this mandate if they pay the Department of Labor and Industry's prevailing wage where they are working, even if the project is not funded at all by the state. Currently, prevailing wage laws only apply to projects funded in whole or in part with state dollars. This means that private construction like single-family homes, senior living communities, multifamily housing, and more, as well as county, local, and school construction projects do not trigger prevailing wage laws, but would under this bill. Exempting contractors from the mandate by simply paying a specified prevailing wage rate doesn't give that employee any of the benefits that this bill seeks to put on every other worker in Minnesota. Now, there's a misconception about prevailing wage that somehow by paying prevailing wage that worker is getting earned sick and safe time or that benefit. That's not true. The state's prevailing wage law simply requires an employer to pay a certain hourly rate and then make up the difference between that and the total prevailing wage rate with some sort of benefit. Now, that could be an insurance, it could be a 401k, it could be time off, but it doesn't require that. And because prevailing wage rates vary county by county, this could create an 87 county fiasco for the person doing bookkeeping and record keeping for that contractor if they're working throughout the state, which is not uncommon. There are a number of examples of where prevailing wage rates vary county by county for the same job classification. And with those county by county differences, you run the risk if you're a contractor of making an honest mistake in bookkeeping, and any of those mistakes under this bill, there's no differentiating between an honest mistake or an unintentional inadvertent mistake, and that's something that is concerning to our contractor members. We have concerns about the bill, as I mentioned, as well as the kind of the one-size-fits-all mandate of providing a specified paid sick and safe time that doesn't take into account the unique benefits that our contractors throughout the state are already providing, and instead replaces it with a prevailing wage exception. I'd be happy to answer any questions the committee may have.
Thank you, Mr. Hansen. Will you be around for a moment or two while we finish up the testifiers?
Absolutely.
Lauren Schothorst? Probably made a mess of that again.
Good evening again, Mr. Chair, members of the committee. For the record, my name is Lauren Schothorst, and I serve as the Labor and Management Policy Director for the Minnesota Chamber of Commerce. In addition to the previous testimony I gave on House File 5 earlier this evening, the sentiments of which apply to this testimony, I'd also like to share a few points related to our members and partners' opposition to House File 11 in particular. House File 11 mandates that employers offer fully paid time off in a specific format for an expanded set of familial persons for an expanded list of qualifying events. The bill requires employers to maintain specific records in a specific format or risk significant fines and expanded liabilities. We have heard from our members in cities that have this policy as local ordinance who are struggling with costs, regulatory burdens, and staffing obligations. So yes, these impacts are real, Mr. Chair, and it's not just small employers. As the legislature contemplates House File 11, we'd also like to point out that these local ordinances are not preempted, creating a scenario where employers will still be required to comply with a patchwork of sick and safe time mandates within Minnesota. Employers rely on physical presence, particularly in small businesses, and expertise, skills, and institutional knowledge that cannot always be simply replaced or put aside to comply with the specific terms of various government-set mandates. While we appreciate the goals of the proposal, we are concerned about the expansiveness of the benefit, how it is funded, and the challenges it presents in terms of managing the needs of individual workplaces, industries, and employees in Minnesota. Thank you, Mr. Chair, for again providing our members with this opportunity to share these concerns with your committee.
Thank you. Brian Elliott.
Thank you, Mr. Chair and members. My name is Brian Elliott. I'm the SEIU Minnesota State Council Executive Director, but specific to this, I also served on the Minneapolis Workplace Partnership Group that included 19 representatives of employers of various sizes, of employees, labor organizations, and business groups that studied and recommended an earned sick and safe time policy to the City Council after dozens of hours of discussion and community listening sessions with various cultural communities and different sized employers and their employees from a range of industries. Specifically to this, to the financial piece of this bill, I want to emphasize the need to adequately do the outreach and education and the role that community groups can play in that work. Here I am not talking about SEIU, but groups that are working both as associations of small businesses, as representatives of workers like worker organizations, and that this bill does contain an important, the fiscal note does contain an important piece of FTEs for the Department of Labor and Industry to actually educate both employees and employers about the rights and responsibilities under this bill, and essentially that helps everyone when there is better compliance because employers understand their responsibilities and their rights under this bill, and when employees better understand their rights under this bill. So there's more in there, but I just wanted to highlight that in particular. Thank you.
Thank you. That ends the testifiers who have signed up. Is there anyone else that wishes to testify for or against this bill? Seeing none, we'll go to member questions. Okay, so who was first?
They were the same time.
They were all the same time. So we'll start with Representative Backer down there. We're going with
Alphabetic order, Chair?
Pardon?
Oh, alphabetic order, it sounds like.
Oh, no, you're just farthest away.
Okay,
Go
thank
with
you.
a couple of questions and
Sure. Right now, the first question I have thank you, Chair, and the author is, please, I'm a small business owner. We have 14 employees. I know that, but there's small businesses that are bigger than us. What type of difficulties will small businesses have with administering this? This can be to the author or any of the testifiers that came forward. That would be my first question.
Representative Lesch.
Well, Mr. Chair and Representative Backer, I think minimal. I did hear the chamber come forward and say, this is another burdensome regulation on business. And let's face it, it is a requirement we're placing on business. There's no question about it. I'm not going to say it's not. But I'm a small business owner, and I offer it. And QuickBooks lets me track it. I think any accounting software out there will let you do it. Now, the requirement that we have in here is different. However, I think we make it relatively simple to report and not any more difficult than you already have to report. It's going to be much less burdensome than your sales taxes. It's going to be much less burdensome than I could tell you probably a multitude of other requirements that small businesses are currently required to follow under state law.
Representative Backer.
Was there any testifiers that wanted to also address that question?
Don't look like it.
It doesn't look like it, does it? That's my question for now. Thank you, Chair.
Representative Robbins.
Thank you, Mr. Chair. Thank you, Chair Lesch. Nice to see you. I just feel like I have to do my diligence for the members at our Judiciary Committee, because in the amendment, you do make some changes in the remedies, and I know, they would be interested in that. So can you just explain why you are now doing civil action for general and special damages And I appreciate that you've changed it to a 3-year violation window to report, but could you just explain why the change in the damages? Thank you.
So, Mr. Chair and Representative Robbins, so I've had several conversations about this, and I don't recall the specifics of why, but if I could have Mr. Elliott speak to that, the genesis of the modification.
Mr. Chair, Representative, that actually came as a request immediately following the Judiciary Committee from the House research staffer to replace the language in the bill with more standard language that is contained in the amendment, and to clarify the statute of limitations so that it wouldn't necessarily simply be interpreted as the 6-year standard, to make some clarity for employers about how long they would have to keep their records.
Thank you, sir. So in the change in what damages you can sue for, is there a special, I'm not sure if it's a term of art to use general and special damages. Could you specify what that actually means?
Representative and Chair, that was the generic language. It is the term of art used in other statutes that covered the areas that we had specified exclusively, but did so in a way that would match up with the other statutes.
I gave Representative Robbins a little leeway there because she was pulling in a different committee, but let's try and keep it to the finances if we can. Representative Koznick.
We go down the order, or maybe Representative
No,
Gunther?
he got his hand up last. So
I thought we were going by LIFO, and that's why Representative Baker got to go first.
No,
Last in, first out. He's not even listening.
You know, we are on TV tonight, folks. So just understand that they're looking for jokes. We got them.
But they're not good.
On line 4.19, Representative Lesch, one of the reasons for utilizing your sick and safe time is closure for employees' place of business due to weather. And as the previous bill, we talked about the impact on our schools and larger organizations and institutions. And so is it conceivable that if a school closes, all the teachers would then, of course, not be there necessarily, but the parents would have to be home and leave their places of employment, or could, if they utilize this. That's a lot of unproductive required time, and almost shut down the state. We had so many sick days, weather-related days this year, that it might be kind of conceivable we'd be a lot more people staying home and not being Minnesota tough and bold north. And then my other question was, how does the sick and safe time incorporate, how does your bill incorporate and work with the previous bill that we heard, the paid family leave, other than, one's maybe a little short-term, your bills for maybe short-term issues, and the other bill is more long-term, but put them together, I think there's big implications for businesses, and one might be recognized as a cup of coffee a week cost to the employer. This is just a day here and a day there, and continues to add up. How do they work together in your mind?
Representative Lesch.
Well, thank you, Mr. Chair and Representative Koznick. Having these other provisions in to not just, having the flu or Ebola or whatever else you got, but including like inclement weather, like school closings, or being a victim of domestic violence were important for us to place in there because they have the same effect on an individual as being sick and being required to stay home. Now, if you got a situation where you got school closings, that's an entire community that essentially is sort of shut down already in many cases, and parents are already having to stay home with a child because their school closes. This merely alleviates the additional burden that presents where the parent has the option then of using sick time for that day. If they cannot forego that pay and they've banked that time, that they should be allowed to use it for that. So we thought that it was appropriate. We also think that this fairly spreads the burden across the community. So in this case, if one parent has to be out doing work on that day, the other parent can then afford to stay home to take care of the children and then not forego that income just for that one day. As far as the differences, how they work in tandem, this bill was enough for me to get to know. So I'm not familiar how it works with the bill that you just heard. However, I think Mr. Elliott, putting you on the spot, can probably speak to that of how this would kick in.
Mr. Elliott.
Mr. Chair, Representative, very quickly, the primary way that these work together is that the bill you heard previously requires a 7-day event before leave can be taken. The idea behind the sick time bill is that everyone does get sick here and there, everyone's kids get sick here and there, and people need to take a day or an hour, perhaps even just to take their child to the doctor to get that strep culture. So the idea here is that the sick time bill is for very short-term use, as opposed to the paid family leave, which are for larger events.
Ledger 2, so we're going to go to Mr. Gunter. Representative Gunter.
Thank you, Mr. Chairman. Just out of curiosity, we know the paid family leave costs 0.65%. What is the earned sick leave cost as a percentage of payroll?
Representative Lesch.
You have that number? Thank you, Mr. Chair. Well, according to the Bureau of Labor Statistics, and this is a survey of employers, Mr. Chair, Representative Gunther, the average cost is 0.75%. But the wage benefit share of total cost varies by industry. So even in high labor service industries like restaurants, labor costs are perhaps 1/2 the total cost. So when you take this as a portion of all overall costs, the percentage resulting from paid sick and safe time is closer to 1/3 of 1%. That's at the high end.
Just out of curiosity, we give
Representative Gunter.
1 day of paid earned sick time and safe time for every 30 days worked, right?
Well, it's, Mr. Chair.
30 hours.
It's hours, 1 hour for every 30 hours.
There's where I was wrong. Thank you.
Representative Haley.
Thank you, Mr. Chair. And to Representative Lesch, do our direct neighboring states have this policy?
Representative Lesch.
Okay, so, Mr. Chair and Representative Haley, no, I can tell you the states that have it, and there are far more cities across the nation. There are several dozen, probably like 50 cities or something.
You
But
cannot
states-
tell us 50 cities. That might take too long.
Huh? You know, Mr. Chair, I mean, like 75% of all statistics are made up on the spot, okay?
That's our concern.
But I can tell you, here are the states, okay? Oregon, Rhode Island, Vermont, Washington, Washington, D.C., New Jersey, Massachusetts, Maryland, Connecticut, California, and that raging bastion of liberalism, Arizona. They passed it with a INR in 2016.
Representative Haley.
Mr. Chair and Representative Lesch, I guess my concern was our neighboring states. I'm concerned about our competitiveness and our ability to create jobs, keep businesses here, incent businesses to come. And when we layer on the previous bill, we heard this bill, the bill we're going to hear next, and our already high tax structure, I think it's concerning for our businesses. I have an additional question, though. Can you speak to hospitals, nursing homes, police, fire, other critical care type industries, and how you would see this impacting their ability to serve people in emergency settings and hospital settings?
Representative Lesch.
Well, Mr. Chair and Representative Haley, so to answer the first part of your question, Minneapolis, St. Paul, and Duluth have had this now for several years, and they have not seen the impact on businesses that you're suggesting. It just hasn't happened. And the same thing has not happened in other states that I labeled off. That said, those types of, I guess, jobs that you're talking about, police, fire, paramedics, those employers inherently prepare for emergencies. I mean, they are set up to do that. They have backups and backups for backups. So if one person gets sick and has to use it, they're already going to be prepared for a mass casualty or catastrophic event, that they should be prepared to have that person backed up in case someone gets sick.
Mr. Chair and Representative Lesch, I appreciate that comment, because I guess that's my point. I trust that employers, responsible employers, are making these decisions on how to staff when somebody's out. And one last question. I'm curious about the increase from the $1,000 to a $10,000 for the penalties, and why the necessity to be so punitive.
Well,
Representative Lesch.
Mr. Chair and Representative Haley, quite frankly, we've seen, or I guess in my opinion, $1,000 to just flout the law openly, I think was not an adequate penalty. For an employer could simply look at this as another cost of doing business and to pay on that. We wanted to make sure that businesses were following the law and not just taking a calculated risk of having to pay out by ignoring the law. And this also, I would add, this only applies to repeated and willful violations.
Representative Keeble.
Thank you, Mr. Chair. And I was thinking back to Representative Koznick's question about, how this would interact with the paid family leave. And I think about Delia, the woman that I referred to in labor back in 2007, when we were working on this before I was elected, and actually when my last name was Anderson. And so I think about her, and her telling me the story about how her son broke his arm. She took time off for that. Her daughter got sick, so she took time off for that. She had used, kind of hit the end of the rope with her employer, and she got sick. And she ended up having a severe kidney infection, and then ended up having to have her a kidney transplant. And so I can kind of see this paid sick time circumventing the medical leave that she would have needed. I also think that this would help us attract workers versus by offering generous benefits. And so I think this would, we hear a lot from our employers that they're desperately seeking workers. And so I think this would really help attract workers to our state. This is an issue I've been working on for a very long time. It means a lot to me. And with that, I'd like to request a roll call, please.
I didn't hear a question in there. Representative Backer.
Thank you, Chair. And Representative, two things. Number one, when you've been working on this over the last couple of months, who were the stakeholders that you reached out to help draft this bill?
Well, I think first off, Representative Lesch has been working on this for several years.
Yeah.
So you can
Over
start
a
mentioning
decade.
who you mentioned or brought in as stakeholders.
So, yes, we've had business owners, we have had workers, we have had folks who represent labor because they deal with these labor questions on a regular basis. We've had faith groups, including Isaiah. This is one of those things that the Oscars, you start mentioning people and you leave someone out and you get in trouble, Mr. Chair. So,
You've never worried about getting in trouble.
oh, that's probably true, but I don't know. Do you want to? Who are some other folks, Mr. Elliott, that we've worked?
Is that enough, Representative Backer?
Yeah. One of the concerns, and I appreciate that, is if we look, this is something that I always constantly fight as on the western part, is if you go down from Canada down to Iowa, no longer we have larger communities on the Minnesota side. just from the tax consequences. When a business moves from, which has happened, Worthington, Minnesota, Wilkin County, to Fargo, Minnesota, North Dakota, excuse me, they save $8,000. So my concern, which we do something like this with our staff people already. We have a very flexible, because we understand that. But there are so many communities and communities in North Dakota, South Dakota that's larger, and just like Representative Haley has, it's a different story if our other states are looking at doing it. And down here in Minneapolis, you guys have an economic engine that's totally different than in greater Minnesota. And what happens is in our area, because of us small businesses, we see entrepreneurs going to North Dakota and South Dakota. So I would just ask we keep that in consideration, because I think it's unhealthy to have a state where 80% of the population is in a 7-county area, where we have so many other resources with the other 80 counties. So I would just ask, and I don't have an answer for you, but I do know as going door knocking and doing parades, when we do a parade from Breckenridge to Wapaton, a lot larger community in Wapaton and individuals. So I just keep that in mind, and that's a concern that I have with this bill. Thank you.
Seeing no other questions, because I don't think there was a question there.
No statement. Thank you, Chair.
I will give the last word to Representative Lesch, and then we will take a vote.
Thank you, Mr. Chair and members. The point of this bill is that no matter where you live, where you come from, or the color of your skin, through our differences, we want many of the same things. We want to be able to spend time at home with their kids when they're sick to make them feel better. We want to be able to see a doctor before whatever ailment we got goes from bad to worse, and we want to be able to recover from the flu without missing bills or losing our job. And I will confess that on first deadline week, I absolutely held hearings with the flu and was coughing on people, and I feel guilty about that. Folks in general should have the option to remove themselves from that situation and save business some of the overhead costs of getting a pool full of sick workers or well. So this bill is about moving toward the kind of caring state we all want Minnesota to be, and I ask for your support.
Hearing that, will the clerk take the roll? I got to renew the motion. House File 11, as amended, the return to Ways and Means. With no recommendation, but to go where you want.
Yeah, I'm sorry. Was that a question for me, Mr.
No.
Chair? Okay, thank you.
We're just renewing the motion, House File 11, to be returned to Ways and Means, as amended.
Chair Mahoney.
Yes.
Representative Newer.
Yes.
Representative Gunther.
Pass.
Representative Backer.
No.
Representative Claflin.
Yes.
Representative Davney.
Yes.
Representative Eklund.
Yes.
Representative Haley.
No.
Representative Hassan.
Yes.
Representative Cagle.
Yes.
Representative Koznick.
No.
Representative Meckland.
No.
Representative Moran.
Yes.
Representative Robbins.
No.
Representative Stevenson.
Yes.
Representative Sundin.
Yes.
Representative Zhang.
Yes.
Representative Gunther.
The motion passes 11-6. You are on your way to Ways and Means.
Mr. Chair, we have House File 6, which will be referred to Ways and Means.
Mr. Chair, members of the committee, I would like to move House File 6 to the Committee on Ways and Means.
Thank you, Mr. Chair. Please proceed.
Mr. Chair, this bill has been through a number of particular committees, but I have an amendment that I would like to put it on to get the bill in the fashion the author would like. So I would move the A15 amendment. The A15 amendment, I'll go over it relatively quickly. On page 1, subdivision 1A, it's authority to investigate. It gives the Department of Labor and Industry the ability to investigate and go into employers' offices to investigate wage theft. Court order for, on page 2, it has a court order for entrance and inspection. We have been finding that there's been a number of refusal of entry. So they now will be able to get a court order to go in and take a look at and investigate and interview and take records as needed. The third piece on here is state licensing or regulatory power. This gives them the power, the Department of Labor and Industry, the power to share that information with state licensing, whomever or wherever it may be. Public contracts, this also gives the ability for the department to share this information with other departments and so that they know that they are dealing with someone who is stealing wages from employees. On page 3, notice to employees of compliance and order and citation. Essentially what that does is it tells the employees that are of the employer that's being investigated that their company is being investigated for wage theft. Might give them the courage to come forward themselves. Enforcement and remedies, this allows the Attorney General the ability to also investigate and prosecute. On page 4, citations, this is just the ability to write a citation to the employer and gives them a number of days to pay their employees and or any fines and take this off, much like a parking ticket would be. I don't like to particularly go downtown and have to go to court when I get in a parking ticket, and makes it simpler. This on page 5, section 15, enforcement remedies, it again provides the opportunity for the Attorney General to be involved in this particular crime. On page 5, line 14, this puts in the cost, $2.2 million per year. So for a total of $4.4 million per biennium.
Thank you, Mr. Chair. We have a 15 amendment that puts the bill in the shape the author wants. All those in favor, please say aye.
Aye.
Opposed? See none. The amendment has been adopted. Please proceed, Mr. Chair.
Mr. Chair, we have testifiers here. I will explain the bill, but again, this is primarily the financial end of this. So I will start at the back. This bill will cost $4.4 million per biennium. It hires a number of FTEs and pays for software, IT updates to the system so that they can track and do the investigations that they need to. Otherwise, this bill is relatively got a lot of stuff in it. And actually, the amendment went through quite a bit of it. It does require some record keeping on the employer's part, whether the employee is paid by the hour, shift, day, salary, week, salary, piece, or commission. It also includes that the employee, including for all employees paid at piece rate, something that we haven't had before. The bill requires the employer to make any personal policies provided. They have to inform the employee of any personnel changes. And they have to keep a copy of that notice. Page 5, all the records must be readily available for inspection. And the amendment changed that to basically to reasonable hours. There is a fine for not providing records. That fine is $1,000 for the first time and up to $10,000 for repeated fines. It actually lays out where wage theft is described in the statutes. It was relatively unclear, but now we're making it very clear. Again, see, that's the Attorney General. On page 6, line 25, starting at line 25, it again lays out that no employer shall commit wage theft. It describes what wage theft is. Enforcement, on page 7, the use of an enforcement provision in this section shall not preclude the use of any other enforcement provisions by law. So there are a variety of other places that the law takes into consideration on wage theft and the amount of theft. Page 717, we went over the citations. On page 8, we have some pretty strong language on retaliation. If an employee takes off after an employer, if an employer retaliates against an employee, there are remedies that the employee can take against the employer. It requires, on page 9, it requires a statement of earnings by an employer and notice to the employee. So what this pretty much does is just, you got to tell the employee, you got to give them a paycheck. You have to give them a pay stub that lays out how they're being paid, by the hour, by the day, by the piece. As I said, stated earlier in the bill, we're covering all aspects of how somebody would be paid and on what. The other thing that I really like on this particular page is line 22, the physical address of the employer's main office or principal place of business. And then further on, it says the telephone number of the employer, something that's not always given out. On page 10, it talks about what the employer shall provide in written notice so that an employee would know if they're not getting what they're due. So I'll leave it to you to read, but it goes the rate of pay, any allowances. Quite often what happens is that employers provide like a lunch or a breakfast or travel, transportation, and they never tell the employee that that's going to be taken off their check. That has to be laid out in a piece of paper that you give to the employee when you are hired, when they are hired. Paid sick time, paid vacation, or any other time off accrued. Whether the employee is exempt from minimum wage or overtime provisions, generally a list of how they're making their money and how they're making their wages. At page 10, line 27, we changed In law today, you're supposed to be paid at least once every 31 days. We changed that to once every 16 days to, what happens is that an employer will tell the employee, well, you know, you're supposed to get paid at the end of the month, but I'm having a little short of money or whatever. So the employee keeps working and they lose 6 weeks of pay rather than 4 weeks of pay. And what we're trying to do is cut that down so that an employer is not paying their wages. The employee starts to realize that sooner and doesn't go back to work only to have more money stolen from them. And there is a provision in the bill that turns this in, and that would be on page 18, line 5, it starts. What we're seeing is businesses using this as a business plan, and they end up stealing a lot of money. So we put the provision in to put some real teeth into this law for those criminals that are stealing money from employees of an imprisonment. I'll just read it. Imprisonment for not more than 20 years or to pay a fine of not more than $100,000. And then it really, the line here is, or services stolen is more than $35,000. So this is a major crime. You get 20 years or 10 or 20 years for stealing $2,000 from a bank. But in today's world, you get a fine for stealing $35,000 from an employee. Totally unacceptable. And again, the end of the bill, section 19, we put the dollar figures in, which is 4.4 over the biennium. We have some testifiers, and if you would like to call them.
Thank you, Mr. Chair. We have Steve Miltich.
He might have had to leave, but.
Steve, please come on down.
Yes, please.
Good evening.
Please state your name and proceed.
My name is Stephen Miltich, and I am a resident of St. Bonifacius, Legislative District 33A. Mr. Chairman, members of the committee, thank you for allowing me to testify. I am the head custodian of Orono Elementary Center, District 278. The school district uses a time clock system which routinely rounds up sign-in time to the top of the hour. My employer expects me to have my buildings opened up at 6 o'clock each morning. That involves unlocking or opening more than 24 doors and checking the operation of 5 boilers. The timekeeping system, though, will not allow me to punch in before 5:45. When I do punch in, the computer automatically rounds up the time to 6 o'clock, effectively stealing 15 minutes of my labor every day. That same computerized system manages staff absences, but follows its own set of rules. Next week, I have a medical event for which I actually need only 1 hour of sick leave. The school system, however, allows a minimum leave of 2 hours. Our sick leave is a benefit for which we have negotiated, and it is earned through the work we produce. The timekeeping system in Orono schools is forcing us to use leave time we should rightly be able to bank. We recently added an activity center to our district, and that addition has increased the hours and days requiring support staff, leading to a 3rd work shift and a transition to some 10-hour, 4-day work weeks. Break times are one of the long-standing benefits we have negotiated for our custodians. Those working 40 hours over 5 days enjoy a total of 5 hours of break time each week. Those working 40 hours over 4 days have only 4 hours of break time. We attempted to negotiate more, but the district would not move on that. But they're effectively experiencing the theft of 1 hour each week. We are the victims of a system the school district has put into place. Thank you very much.
Thank you so much. We have Melissa Hastings. The Commissioner Nancy, please, let me. Welcome, Commissioner. Please state your name and proceed.
Thank you, Mr. Chairman and committee. I'm Nancy Leppink. I'm the Commissioner of the Minnesota Department of Labor and Industry, and it's a pleasure to be with you this evening. In Minnesota, we hold fast to the belief that if you're an owner of a business, if you're a worker of that business, if you work hard and you play by the rules, you should be able to put a roof over your head, put food on the table, you can raise healthy and educated children, and even put a bit away for retirement. But when businesses gain a competitive advantage through illegal and unfair employment practices, it triggers a race to the bottom, and the consequence is those businesses who play by the rules are put out of business by those who don't, and workers lose the good jobs those businesses create. Wage theft is a term that has become a rallying cry against illegal and unfair employment practices that have become systemic in highly competitive, labor-intensive sectors, including janitorial and maintenance services, home care services, security services, call center services, services provided through the platform and gig economy, and in sectors such as the restaurant and hotel sector and the construction sector. These are all sectors with fierce competition is fierce, and reducing labor costs through illegal and unfair means can create a significant competitive advantage. Of course, good businesses are not the only victims of these practices. I know few workers, certainly few low-wage workers, and even seemingly well-paid workers who can afford not to be paid for all the hours they work, not to be paid for the overtime they work, not to be paid the legally required or the agreed to amount, or to have their pay delayed for weeks, or worse yet, not to be paid at all. So we have a decision to make, and are we going to stand by and allow this race to the bottom, or are we going to right the course? The Walz and Flanagan administration believes the only decision is to right the course, and key to righting the course are strong laws and effective and efficient law enforcement agencies whose mandate is to achieve compliance with those laws. This bill, as amended this evening, would put in place critical requirements and protections and investigative tools that will better enable the Department of Labor and Industry and its partners, the Attorney General's Office and county attorneys, to effectively and efficiently enforce the law, so employers who play by the rules have a level playing field upon which to compete, and workers who work hard are paid the wages they're owed. These critical requirements in the amended bill is the requirement that employers maintain employment records that identify all employees they employ and that documents the terms and conditions of their employment agreement. The bill also has the requirement that employers provide their workers with written notice of the terms and conditions of their employment and provides their workers with an earnings statement each pay period consistent with that agreement. These provisions are really in the interest of both employers and workers, as they document the essential terms of their employment agreement and evidence through earnings statements that those terms are being adhered to during the worker's employment. I can't imagine an employer who would enter into a contract with a subcontractor where the terms would not be effectively stated and what would be paid for that contract would not be clearly articulated. The same should be true when a contract, an employment agreement is entered into between a business and their workers. And that is all that is being required by these provisions. The bill also requires employers to maintain records at their workplace in a manner that will allow them to be readily produced when they are requested by the department. The department cannot effectively and efficiently resolve disputes or conduct effective and efficient investigations if employers cannot readily provide the department with their employment records. The bill also authorizes the department to utilize critical investigation tools when confronted with an employer who refuses to cooperate or obstructs its investigation. In my experience, which has been long, these investigative tools are used infrequently and are typically necessary only in the most egregious circumstances. For example, in labor trafficking cases. The bill would also provide the department with subpoena authority to enforce a demand to take testimony and produce for inspection documents and other evidence, and would provide the department with inspection authority, inspection order authority, which would allow it to obtain a court order after demonstrating a need to conduct an investigation of a workplace where an employer has refused the department entry. The bill also provides incentives for employers to make and keep employment records and provide them when requested by the department. The bill provides a consequence for failure to keep employment records and submit them upon demand to the department. And it has a provision that on the first failure to respond to a demand, a $1,000 penalty, but thereafter a penalty of up to $10,000, considering the size and circumstances of the employer, a penalty of up to $10,000. So you have to understand that when an employer fails to make or keep records, the inefficiency that this causes and ability to determine whether or not there's a wage violation, often even if the employer is in compliance with the law, as I said earlier, keeping employment records is in the interest of both employers and workers. So consequently, if an employer fails to respond to a demand, the department would be compelled to use other means to try to document whether or not wages have been paid properly, dramatically increasing the amount of time it would take to resolve a dispute. It also allows for the department to issue a citation to obtain expeditious resolution of violations involving limited amounts of back wages owed. Often, the final paycheck is what is owed to a worker, and there is a dispute with the employer as to the payment of that paycheck and also the amount of pay that's owed to the worker. Again, the citation authority would allow for the commissioner to more expeditiously resolve those complaints. And further, the bill makes clear what are violations that constitute civil and what constitutes criminal wage theft and consequences for violations of those civil and criminal penalties, and ensures that both interested parties, the employer and the worker, understand what constitutes a violation of the law and what does not, and are informed of the outcomes of a department's investigation. Finally, over my career, many employers who are playing by the rules have expressed to me their frustration that employers who don't play by the rules continue to have their license renewed and to win contracts despite their illegal and unfair labor practices. This bill would allow the Department of Labor and Industry, when it's found non-compliance with wage and hour requirements, to inform contracting authorities of those violations and of those findings, and also licensing authorities. So those authorities, within their authority, can take action, appropriate action, based on that information. So the department has put to good use the additional resources that it was appropriated in 2018 and for 2018 and 2019. It has significantly improved its numbers, reducing from 25 days to 4 to 5 days its resolution of wage claims, and increased its payment of wages from 45 to 53%. It has also been able to increase the number of wage claims processed from 992 wage claims in 2017 to 1,365 wage claims in 2018. And furthermore, it has helped the number of workers, it's helped increase from 60,000 in 2017 to over 105,000 in 2018. So as a consequence, the department has put to good use the additional resources that was appropriated in this biennium. However, as the testimony that has been given in this committee and in other committees regarding the severity and the complexity of wage theft violations, it is critical that the department have sufficient resources to not only attempt to resolve complaints, but also has the ability to conduct inspections of workplaces which it believes are in violation, but for which it has not received complaints. And many workers, as have testified in previous committees, have indicated they're often fearful to complain because they fear retaliation, And so the department having sufficient resources to engage in worksite-based inspections to determine whether practices such as workers not being paid at all, workers being shifted from one workplace to another to avoid recording hours that exceed 40 at any one workplace, workers who are working off the clock, reporting hours early but only punching in later. These claims can only be effectively investigated through worksite-based inspections. And so the department, in its fiscal note for this bill, has requested additional resources to be able to fulfill the objectives of this bill, to add additional inspectors, about 11.5 FTEs, and 2 additional administrative staff and outreach staff to support the work of those inspectors, and also to engage in additional outreach work. Because as has been articulated in many of the hearings on this bill, the wage theft in many of these sectors has become systemic. It's a way of doing business. And furthermore, that there's a need for the department to be more proactive in its investigation and to conduct more thorough and comprehensive investigations in order to find the violations that are occurring. So I thank you for your attention and the opportunity to testify.
Thank you, Commissioner. I think if you can wait for a few minutes, if there are any questions, I would like to bring the next testifier. Ms. Hastings. Welcome. Please state your name and proceed.
Thank you. Good evening, Mr. Chair and members of the committee. My name is Melissa Heising, and I'm Legislative Director at Minnesota AFL-CIO, here to speak on behalf of the Coalition to End Wage Theft. The Coalition to End Wage Theft is made up of directly affected workers and advocates, including the Advocates for Human Rights, the Building Trades, the Carpenters, SATUL, the Fair Contracting Foundation, Greater Minnesota Workers Center, University of Minnesota Labor Education Services, Minnesota AFL-CIO, and many other labor and community organizations. The coalition has worked with the Department of Labor and Industry for several years to share and develop strategies and best practices for addressing the problem of wage theft, and done outreach, education, and organizing around the issue. Sometimes wage theft is obvious, like the high-profile examples from the past few years when the trucking company, Lakeville Motor Express, and Crystal Care Home Health both shut their doors in an attempt to keep the wages their employees had earned. Sometimes it's more subtle, like when employees don't pay their employees for all the hours worked by having them work off the clock before or after their shift or during their breaks. Sometimes employers deny workers their benefits, overtime pay, or even the minimum wage, perhaps by misclassifying those workers as independent contractors when they're not. According to Dolly's conservative estimates, each year 39,000 Minnesota workers experience some form of wage theft, resulting in nearly $12 million in unpaid wages. Right now, unscrupulous employers know that if they commit wage theft, they may not get caught, and if they do, the penalties are low enough for them to consider it just a cost of doing business. When these bad employers use wage theft as a business model, they aren't just hurting those 39,000 workers and their families, but our entire state economy. When bad employers don't pay their workers what they're owed, they can undercut the rest of the businesses that are following the law and drive down wages across the board. You heard from the commissioner about the role of the Department of Labor and Industry in this bill. I also want to highlight that this bill clarifies the Attorney General's authority to investigate and enforce violations of Minnesota labor law. Several other states use a collaborative approach between their state departments of labor and the AG's office, and it has proven to be effective in protecting workers and prosecuting the most egregious offenders of wage theft. I think we can all agree that when you work, you should be paid for what you've earned for that work. The comprehensive approach to combating wage theft taken in House File 6 will help make that a reality for workers across the state. Thank you.
Thank you so much. Next is Batista.
Can I make one comment? Just one comment.
Representative Koznick has got a quick comment.
Just a quick comment for the committee and people at home. Company named Lakeville Motor Express was mentioned. I just want to say that they do not operate in my district or in the city of Lakeville. They're actually out of New Brighton, but just want to set the record straight.
And that's a good thing.
And they,
The record straight is their ass.
Thank you, Representative Koznick. You're on the record on that one, so please state your name and proceed.
Buenas noches a todos. Mi nombre es Nelly Bautista. Soy miembro de CETUL, Centro de Trabajadores Unidos en Lucha. Estoy aquí para compartir mis experiencias vividas en diferentes ramos de la industria del trabajo.
Good evening. My name is Nelly Bautista. I am a member of CETUL, the Center for Workers United in Struggle, and I'm here to share my experiences in different working industries.
Una de esas experiencias fue la que me trajo a conocer CETUL. Yo viví el robo de salario.
One of those experiences was how I came to know this organization, CETUL. I was a victim of wage theft.
Esto ocurrió aproximadamente hace 2 años trabajando para una compañía de limpieza. El dueño de la compañía me solicitó le consiguiera personas que quisieran trabajar en limpieza, a lo cual accedí y lo puse en contacto con 4 personas.
This happened approximately 2 years ago when I was working in the janitorial industry. The owner of a company hired me, and he also asked me to find him 4 additional people who could work in cleaning, which I agreed to, and I found him 4 other people.
Ya tratado con las personas y accediendo al compromiso, nos fuimos a limpiar apartamentos.
So the group of us were working cleaning apartment buildings.
Transcurrieron 15 días de trabajo y le solicitamos nuestro pago, y él se negó a darlo.
At the end of a 15-day pay period, we asked for our payment, and he refused to give it to us.
Estuvimos insistiendo entre llamadas y mensajes hasta que pagó a las personas que recomendé, pero a mí no me quiso pagar.
So we insisted by phone calls and text messages that he pay us, and in the end, he paid the people that I had brought to him, but he refused to pay me.
Argumentando que yo estaba agitando a la gente para que le exigieran su pago.
He said he refused to pay me because I was agitating the other people so that they would get their payback.
Recuerdo que ese tiempo la pasé muy mal, pues no tenía para el pago de renta y comida. Fue una desestabilización económica, consecuencia que sufrimos nosotros los trabajadores.
I recall in that time, I went through an extremely difficult time. I did not have money for rent or food. This is an experienced an economic destabilization of my life, which is a consequence that workers suffer.
Debo confesar que yo tenía miedo de enfrentarme a este problema social, pensando en las consecuencias que esto me pudiera traer, pero gracias a Dios todo salió bien.
I must confess that I was extremely afraid of retaliation when confronting this problem, but thanks to God, I was able to get my wages back.
CETUL fue fundamental para que pudiera recuperar mi pago.
And CETUL was fundamental for me being able to get my wages back.
Estoy consciente que si no levantamos la voz, nadie podrá hacernos justicia. Es por eso que estoy delante de ustedes para hacer notar este abuso que seguramente la mayoría de los presentes ha sufrido alguna vez.
I'm conscious that if we don't raise our voice up, no one can create justice for us. That's why I'm here to let you all know about this abuse that is happening that surely many people here have experienced.
Solicito su apoyo a las autoridades para defender el derecho del trabajador, porque todo obrero es digno de su salario.
And so I'm here to ask for your support with this, to defend workers' rights, because every worker is deserving of their wage.
Muchas gracias.
Thank you so much. Next is Garcia. Abel Garcia. Don't see her around. So the next person is Ms. Shorthouse, so if she's around. Welcome back to the committee. Please state your name and proceed.
Last time, I promise.
All right.
Good evening again, Mr. Chair, members of the committee. Lauren Schothorst with the Minnesota Chamber of Commerce. I appreciate the opportunity to provide testimony and share our commitment to protecting employees from this crime. I'd first like to reiterate that the Chamber and its members do not support, condone, approve of, or defend wage theft as a business practice. So my testimony is not what this is about. As policymakers consider the best approach to addressing this issue, our members want to make sure that caution is exercised when legislating on wage theft, so those willfully engaging in labor trafficking or other such practices are not protected by ineffective laws, and so that employers who inadvertently find themselves in violation of certain wage laws are not considered to be such criminals. We do not believe House File 6 is the right approach. If the intent of legislation addressing wage theft is to hold bad actors accountable, then we think it makes sense to more clearly define wage theft as an intentional failure to pay an employee all wages to which that employee is entitled, ensure the Department of Labor and Industry has the resources to sufficiently enforce the law with informed employers and employees alike, and make sure the penalties serve as sufficient deterrence. Removing intention from the definition of wage theft and creating an overreaching regulatory regime that does not include reasonable good faith employer protections or due process provisions does not advance the goal of preventing wage theft. We also have concerns that smaller employers who may not have more sophisticated payroll software systems or HR staff could inadvertently make a payroll error. Instead of simple process that allows the error to be fixed quickly, House File 6 proposes a complicated process that subjects employers to a potential criminal designation and serious penalties. While we are proud that Minnesota employers are regularly recognized as providing some of the best workplaces in the nation, any action that reflects poorly upon our business community is something we take very seriously. While House File 6 in its current form is unworkable for our members, the Minnesota Chamber supports addressing the issue. As the legislative process continues, we believe we can accomplish what I believe is a shared goal of protecting employees from wage theft intentionally committed by bad actors and holding those bad actors truly accountable. Thank you, Mr. Chair, for the opportunity to share this perspective with your committee today.
Thank you so much for your testimony. Just wanted to check if there's any other person who wanted to testify on this bill. I see a couple of hands. Please come to the front and welcome to the committee. Please state your name and proceed.
Thank you, Chair and members of the committee. My name is Marlis Nygren. I am a current CPA with an inactive certification. I have worked with small businesses for over 30 years, and most recently I was the emergency rental assistance kind of director, program developer for the Downtown Congregations to End Homelessness. And during my short 6 months in developing this program and handing it off to the congregations, we ran into several people who called needing rental assistance because they have had experienced wage theft. I don't remember noting that the commissioner mentioned, but temporary agencies are probably one of the highest violators of this particular issue. And those are the people that we ran into considerably. And a lot of them, they didn't know what to do. They didn't know if there was any recourse. Often we had to connect them with an attorney who donated their time because there was no other agency that we could send them to get the kind of support that they needed. And so as far as the financial impact, the people who are impacted are unable to pay their rent or find food. They also end up in court with unlawful detainers and then end up in difficult situations where it inhibits their ability to rent in the future because of these kind of situations. Also, the, excuse me, I'm a little nervous. Also, their health and the amount of stress that they experience with fear, not knowing what to do, why did it happen? A lot of times they get bullied. I had to deal with these people kind of from the beginning to the end of their process and trying to get rental assistance, as well as if we were unable to help them, they also had to go to Hennepin County because Hennepin County has a rental assistance program. So as you can see, it becomes a rather mushrooming problem in several respects with regard to what happens to people. Also, I would like to say, with regard to the record keeping, QuickBooks is used by 95% of small businesses around the country and probably in other parts of the world. And it's very inexpensive, and any employer can track any of these issues that were talked about today, from paid family leave to paid sick time to this particular issue as well. So there's really no reason why any small business owner should be able to say that we aren't able to comply, because QuickBooks is a very highly used and robust system, and they're always increasing its capabilities so that it's useful to small businesses. And finally, I would like to say that being an accountant for small and large businesses for over 30 years, I have run into at least 20 small business employers that have technically, in my opinion, committed fraud. And so if I am one person in the accounting industry that has experienced issues, and several times it was intentional, many times it wasn't. But the thing is, I think this is a very serious issue, and we need to help our small businesses get into being really competitive and competent in what they do. Thank you.
Thank you so much. We had another testifier who raised his hand. Please come to the mic and state your name and proceed. The next testifier, please get close to the mic area.
Hello, Mr. Chairman, committee members. My name is Henry Scott.
Please get close to the mic.
Hello, Mr. Chairman and committee meeting members. My name is Henry Scott, and when I came here today, I had no intentions on testifying. But as my day went along, today I am a victim of wage theft. I got fired from my job today because I was complaining about not getting my wages. And as I'm sitting here, I'm wondering, what am I going to do? How am I going to pay my rent? I'm a single father, and I have not a lot of places to turn to. I think that businesses shouldn't have this type of power. Something should be done about that. So I just wanted to get it out there that, like, this is not just regular job. This is temporary services and everything. And when a person get their money stolen from them from wage theft, and then you get fired on top of that, that leaves you with a lot of confusing feelings. So I'm here to support this bill too, and I'm asking you people, please pass this bill. Thank you.
Thank you for sharing your story, and I'm sorry that you were fired and you were impacted by the wage theft. Sorry to hear that. The next testifier, please state your name and proceed.
Good evening, everybody. Thank you for this opportunity. My name is Faustino Constante. I am the owner of Constante Construction Company. I am a good employer. I pay my workers what I owe them for their work, but there are some employers in this industry who break the law and don't pay their workers. I can't compete with these companies that don't pay their workers. Please do something about this so my business can survive and my workers can earn a living. Thank you. You know, even. As you know, it's very difficult to run a construction business, but especially difficult to do it when you are a small company. Last year, we suffered a terrible loss to a company from a different state. they don't complete the contract and they don't pay. They decide not pay all the money settled on the contract of this project. I had to sell cars, tools, and other in order to cover the money to pay all the workers. Now, we are trying to work on this new market on Minnesota. I feel I am living almost the same experience again. We need help. This situation has to change. Sometimes I think the business model is the problem. Right now, we don't receive enough money to cover the benefits to all the workers because the big companies, they don't choose the right subcontractor. When the general contractor, they chose the lower bidders, they looks like heroes and they make good money, but the subcontractors are forced to pay less money and less benefit to the workers. At the end, they are the bad guys in this situation. So we have a few or nothing control about this situation. This affecting my communities, all communities, our families, and therefore I believe that the government agencies need to take more action that will help to stop this kind of the situation and to correct this problem. When I say this, I'm talking for all the workers. We serve to the listening, we contribute to the economy, and we are just asking for something I believe in is fair. I write this letter. My broken English, I'm sorry, but my first language is Spanish. I'm trying to do the best that I can. Thank you very much.
Thank you so much. I think you've done very well to express yourself. Thank you. With that, we would like to open up for any questions from the members. I have Representative. Oh, yeah, you're on the list. Roll call has been requested. Representative Hassan.
Thank you, Mr. Chair. For a minute, I thought you were calling me Representative Sandin. I'm like, when did I change my name? Thank you, Mr. Chair, for bringing this bill. It's an important bill, especially when most people, many at least from my world, are one paycheck away from losing their home, losing everything that's valuable to them. So when an employer cheats and withholds that earned paycheck from a person, and that person gets affected and they become homeless, that should be a criminal offense. That should be something that the law can see it as a problem. I have seen it happen in my district. There are signs of that all over the place. Over the summer, we had 300 people sleeping outside in a tent city. Many of them were evicted from their homes. Some of them had wage theft. It says that there is 39,000 workers who face wage theft in Minnesota. That's reported. There are many who don't report for reasons of immigration, afraid of retaliation. Where I come from, you don't challenge authority. That's what, my culture says, that you never question authority and you just follow the rules. So people in my community will not challenge authority. They will just think that the best thing will be done by their employers, thinking that their employers are making the best decisions for them. The one question that I have for you is people who have home cares, interpreter agencies, transportation, DHS has and HMOs have tendency to delay their payments for a period of 3 months, 6 months. How does that apply to this enforcement And I am very happy that there is enforcement in here. I'm just worried about how does that apply to people who are not stealing wages, but their payments are on hold in DHS, and they don't have enough. It's small businesses. They don't have enough to pay people out of their pocket.
Mr. Chair.
I don't know. That's not something I know, and I can certainly dig into it a bit more. I suspect that it is, I have another bill, and quite regularly it comes to me that there's X number of things that have to be done before the payment is issued. And this is a retainage bill where they retain a percentage of the contract until a variety of things are done, such as the punch list, I'll call it, but some of the paperwork in terms of did they pay the proper wage and some of the other things. And that's the only thing I can think of off the top of my head, but I can certainly dig into it more.
Representative Hassan.
Mr. Chair, thank you. I would love to work offline with you and make sure that we're including that, because I know that happens very often, that DHS holds payments for 3 months or 6 months, and these employers are not cheating or anything, but they don't have money to pay. So I don't know how this enforcement impacts that, so I would love to have a conversation offline.
Happy to do it.
Thank you, Mr. Chair.
Thank you. Representative Haley.
Oh, thank you, Mr. Chair. Thank you, Chair Mahoney, for the bill, and I appreciate your efforts. I just have maybe some questions because I'm not as familiar with this area. The requirement to go from 31 days to 16 days. I'm thinking of our own state. We get paid once a month. Is that, is this going to be a burden for a lot of employers or small employers in particular to make that change to 16 days? I don't know if maybe the commissioner knows too, just the ramifications of that.
I think I will ask the commissioner to step down, but I have not heard of, that has not been the major complaint from businesses so far.
Okay, thank you. Can I follow up, Mr. Chair?
Yes, Representative Haley.
Thank you, Mr. Chair.
Representative Haley, would you like?
Sure, and to the bill author or the commissioner, I'll ask an additional one, and maybe you can weave them together. The testimony was really consistent tonight to your point that there are certain sectors where this occurs most. And I know in other committees, the author, Chair Mahoney, has stated 99.9% of employers in Minnesota do the right thing. And I want to call out, we have very good employers in the state. So the 1% or 1.5% that this is addressing, did you ever consider a more limited approach to address these particular sectors only where you are having the problems?
Commissioner Levin.
Well, I'll let you get to the first question in a minute, but no, I always think that it's if it's good enough for Mike, it's good enough for Tim. And if you're not doing anything wrong in your wages and how you're paying your wages, this bill really will not affect you, period. If you're doing the right thing, you've got no worries. You've got about 6 or 7 pages of paperwork that you have to keep. Now, you add on 6 or 7 pages to the 15 or 20 that you already have to fill out in order to hire somebody in terms of Social Security, getting them to sign that they got the employee handbook and all the other things to help 40,000 or more, and I believe there'll be more. I don't think that's too big of a price to ask for the millions of dollars that we're losing in this particular case.
Commissioner.
I would agree that really what this bill is doing is just making clear good business practices, and that it is really simply obligating, particularly in the record-keeping requirements. When you look at those requirements, they're pretty much common sense. You need to know who you're working for, the business. Often the business, the common name for them is not actually their legal name, their address, the rate that you are to be paid, the hours you're to be worked, any deductions that they're going to be from your wages. These are all just pretty straightforward parts of an employment agreement. And as I said in my testimony, it really protects the employer as much as the worker, because the employer needs to have it clear with their workers what are the terms and conditions of their employment, and therefore in that way they can avoid unintended disputes with that worker because it's clear, it's in writing what is understood agreement. When you make agreements that are oral, that are sort of vague, this is what gets employers into difficulty with regard to allegations of wage theft, and often situations where the department then is trying to divine, what was actually agreed to between the employer and the worker. And so in large part, these record-keeping requirements are just good business practice, but also they are pretty straightforward. And when you read them, they are pretty much common sense as to what would be critical components of any kind of contractual arrangement. So I think that the idea that, yes, there's certain industries where wage theft has become more systemic, but as we receive complaints, it's not just limited to those sectors. But again, what we're asking employers to do is basically what would be a common sense practice to document what is the agreement that you've made with someone with whom you've entered into a contract.
Mr. Chair, just a closing comment, and thank you for that background, and I appreciate your opinion on it. I guess just what I'm hearing from my community, we have maybe 3 large employers, and they're excellent employees. I'm sure they're doing everything as they should. It's the small business community that is concerned about just additional regulation and burden on them in a very tight market and small communities that I represent, where our downtown storefronts are a third of them empty, and we're trying to keep every small employer that we can and work with our chambers and make sure we keep our economies vibrant. And particularly, most of my communities as well are border communities, so a business can take the bridge and they can be in Wisconsin in 5 minutes. So that's just the feedback I'm getting, and that is my opposition to the bill, not the intent that you have. Thank you.
Representative Robbins.
Thank you, Mr. Chair. Thank you, Chair Mahoney. I appreciate all the testifiers and really care about this issue. I mean, it's unconscionable what we've heard tonight, and I do think we should go after the bad actors, and I agree. Also, I've heard you say that, it's a very small proportion of Minnesota employers, maybe 1 or 1.5%. So I tend to agree with Representative Haley that the broad brush maybe is more than is needed in this instance. And I really agree with Representative Hassan. Her points were really to the issue of intent. And if the employer is doing things right and did not intend to cheat, which I think there is examples of that, this is really onerous by taking the intent out. And I had a meeting this week with a large employer in my district who's a union shop, a large construction guy, and he had very specific concerns. I actually asked him to come and testify, but he had a family obligation tonight, so I'm going to do my best. But his issues were they have multiple sites, they have multiple machines, and the rates of pay on different machines in different sites is different. And the mistake could be on his end, or it could be on the employee's end if the employee doesn't keep the records accurate. But there is no apparent place in the bill to deal with that. And because the record keeping is not specified in section 3, I wrote it down somewhere, but section 3.21, it says there will be a specified format, but it doesn't say what it is. So the commissioner can specify the format, but they don't know what it is yet. And then if they don't have it in the specified format in a very short period of time, they'll be getting these onerous fines. And if the employee made the mistake, the employer is still on the hook. And so I really agree with the intent, but I just think the lack of intent language being taken out of the bill is problematic, and some of the record-keeping requirements are really going to pose a problem for honest employers who want to do the right thing. So I just wondered if you could speak to why you took intent out?
Chair Mahoney.
Thank you. That it's one of the reasons that the citation is in there, and the language that says that the commissioner has the ability to fit the fine to the crime and the size.
There may not be a crime.
There may not, but the employer has the ability to challenge the particular citation. So, and we've tried to keep it as simple as possible and keep it out of the court systems. If you put intent in, how many lawyers do you want us to hire? Because that's exactly what will have to happen. You'd have to hire multiple lawyers to take the employer to court, and the employer would end up in court so many more times, even if it's accidental. Whereas with this, the employer can communicate in any of the modern ways with the commissioner or the inspectors and tell their side of the story. Otherwise, the employer would be hiring an attorney to prove intent.
Thank you. Mr. Chair, may I ask a follow-up? So to that point, one of the other concerns I had is Section 8.31, where it says there's a rebuttable presumption of unlawful retaliation. That seems a little strong, that the presumption is that it's unlawful retaliation. And it's rebuttable, which is great, but nevertheless, is there any other place in law where the presumption is that you've broken the law?
Yeah. There is some, the rebuttable presumption is quite often brought up in any of our statutes, and it's used in many different ways. This is not anywhere near as strong as I would like it, but they had to say no. They wouldn't allow me. I mean, I've been retaliated against on the work site. I've been fired for standing up for what my union contract says. And rather than fight that, I went back to the hall and got a better contractor to work for. So retaliation is out there, and out there quite often, and particularly if you're a person of color or a recent immigrant. It's unconscionable that people do it, but we have bullies in the business world that pull that kind of stunt. So I'll let the commissioner answer that also, but she knows that I was a little bit like, no, that's not strong enough. Throw the bum in jail, as far as I was concerned, if they retaliate.
Even though there is a basic presumption of innocence generally.
Please,
Sorry,
Commissioner.
Mr. Chair, Representative. So first of all, I want to assure you that the department has no interest in prosecuting or investigating employers where when we approach that employer and request records in response to a complaint, we note, well, first of all, the first step is for the department to attempt to resolve that dispute. And certainly if the department is detecting that this is an error that was basically inadvertent or a mistake, put a decimal point in the wrong place, filled out the form improperly, you had malfunction with, timekeeping records, that you had an inexperienced employee who was filling out classifications. Certainly these are situations where the department simply wants to inform and educate, to resolve the dispute, and make sure that going forward the employer understands what their obligations are, and the employer has made a commitment to basically correct that error and work in compliance with the law going forward. The interest of the department is, when we engage in an investigation, is to put in the additional resources is where we believe that there's a serious violation, where that violation has become systemic, where it's clear that an employer is deliberately, for example, simply not paying their workers, where workers are only being paid in tips, where workers are Like I said, there's multiple work sites, so once they get to 40 hours, they get shifted to the other work site and they get clocked in there, and then they can avoid having to pay overtime. These are not inadvertent mistakes. These are sort of actions in order to avoid responsibilities for overtime, or simply they are just employers who are taking advantage often of vulnerable workers. I mean, we have situations where workers are intimidated through threats to turn them into ICE, clearly threats of being fired. We have workers who've been paid and then driven to ATM machines and told to withdraw their wages and pay them back to the employer. These are the kinds of cases that the department cares about. This is where we are going to expend our resources, because we don't think good businesses should have to compete against those kinds of practices. And so we do not have the resources to spend time on inadvertent errors.
Thank you. Just
Representative Roberts.
one more, sorry. Thank you, and I appreciate that. And I would, hope maybe going forward that could be clarified into the bill. Just say that there will be, because there doesn't seem to be any like appeal or remedy, and just that your intent is to work with businesses where there's been mistakes. If that could somehow be clarified, I think that would be helpful. But I do have one more specific question about what triggers the commissioner to be able to go into the workplace. The bill didn't seem to say, in the amendment, it says just to carry out these purposes, the commissioner is authorized to enter in these places and then do, extensive work, even confiscating things, and it doesn't say how long they take custody of the evidence. If they seize computers, like how long do they keep it? Is there any remedy? And what would trigger the commissioner having the right to go in there? It doesn't say it's triggered by a complaint, even though you just mentioned that. So if you could clarify that. Thank you.
Commissioner.
So under current, Mr. Chair, Representative, under current law, the commissioner has the authority to enter into any workplace in the state to determine whether or not there's compliance with the state's minimum wage and overtime laws and other laws for which the department has authority. So consequently, there is no restriction on that authority. That authority is true for the majority, if not all, of the law enforcement responsibilities in state government. It's true for occupational safety and health. It's true for other authorities, licensing authority and the Department of Commerce. In each of these instances, it's understood that if you're engaged in business in the Minnesota, then and you are you can be investigated by the state for violations. But as I said before, I have no interest in investigating employers who are in compliance. And so consequently, the efforts of the department would be to be looking at employers that we believe are not in compliance.
And, excuse me, Mr. Chair, and any material seized, they could just keep indefinitely?
Well, it's usually not the practice of the department to seize evidence. Most of the time, we are, copying or scanning payroll records. We are interviewing witnesses. We are is the typical scope of an investigation. So, we might, if records are computerized, we might download copies of them using, a USB key or something like that. But we are not going to be seizing computers. Or we are really a civil enforcement agency, the department, and so we use civil enforcement tools.
Thank you so much, Representative Stevenson.
Thank you, Mr. Chair. And I just wanted to speak briefly to a couple of the points that Representative Robbins just raised specifically, particularly as to the intent issue, because, I'm a prosecutor by trade, and so I have experience of going into a courtroom and asking a jury to find that someone had intentionally done something. And what we often talk about in the criminal law context is how intent is usually the most difficult element to prove, because you have to go into someone's mind. We say intent is a process of the mind. People rarely write down, I intend to, steal my employees' wages. or say out loud. It's not like, a cartoon movie where you have the villain explaining his master plot shortly before executing it, right? That's not the way things usually work. People usually do these things and then they say, oh, it was a mistake, it was everything else. So intent elements are very, very difficult to prove, and that's okay in the criminal law context. It should be difficult. And when you're talking about a crime, which is why it's entirely appropriate that this bill includes an intent element on the criminal aspect. It does. When we modifies Section 609 and it creates a crime, it says intentionally engages in wage theft. On the regulatory side of the world, I don't think it's necessary or appropriate for there to be an intent element, and I think that it would allow for a lot of bad behavior to go uncorrected. And I also think that there is a regulatory purpose for the state stepping in on behavior that might not be unintentional, that might be unintentional, but is still harming employees. So if an employer is engaging in sloppy business practices, not doing a good job of keeping track of records, and they're denying employees the wages that they've rightfully earned, they haven't intentionally denied people their wages under that section, under that meaning of the word, but it's still a good function of government to go in and correct that and make sure that people are getting what they are paid, right? So I agree wholeheartedly with not having it on the regulatory side and having it on the criminal side. I think that's a good distinction to make. I also wanted to comment briefly on the retaliation question. Chair Mahoney is exactly right. It is common in our laws, particularly when you're talking about workplace retaliation, to have a rebuttable presumption of retaliation. You see it all throughout the laws when you're talking about when employers are acting negatively towards employees for doing things that they are within their rights to do, whether it's whistleblower laws or sexual harassment laws. We have this in place throughout our law. I would go so far as to say it's the norm for this area of law. And I would point out in particular, when you talk about when this comes into play, remember that it says a rebuttable presumption of unlawful retaliation under this section exists whenever an employer takes adverse action against an employee within 90 days of the employee asserting rights. And so it's pretty limited in time and in effect. The employer has to do something really specific in order to get the rebuttable presumption. So it's not just a broad brush, you're guilty until proven innocent situation. It's when the employer does something that is really fishy, takes an adverse action so closely after an employee asserts their rights, we do have a rebuttable presumption, and we see that all throughout the law, and I think it's appropriate.
I think that was a clear comment from Representative Stevenson, so thank you so much. And we do have Representative Gunton.
Thank you, Mr. Chairman. I still think the fines are high. They're 10 times higher than they were before for a major violation. However, I'm learning a little bit that maybe they need to be higher. But the statement was made, it helps employers as much as employees. I can't agree more. Today, for every 10 jobs that are open, we have 5 people down in southern Minnesota to fill them. If an employer rips off his employees, he's a stupid person because he's not going to have that employee long. I had 193 employees. I probably ripped them off once or twice in my 30-some years of working in a grocery store, running grocery stores. I didn't do it on purpose. And I want you to remember that, Commissioner. Everything is not done on purpose. And I think there's one person that was not mentioned today that I used to see a lot in the food processing area that I'm from. We have illegal non-citizens, and they are bribed out of half of their salaries. If you don't pay me so much, I will not. I will squeal on you, and you'll be sent back home. That is the most egregious crime I've ever heard, and I know a guy that took care of it for me. But anyway, I think this is a good bill. I think it's for a good purpose. I want everybody to remember one thing. There would not be any employees anywhere without employers. So don't badmouth employers all the time unless you know they did something wrong. Because they might move somewhere else and there won't be any employees. 75% of the population of Minnesota live within a half hour of a bordering state, and we all should remember that. And I like your bill. I co-authored. You know you did. Appreciated that.
Chair Mahoney.
If there's no other questions,
We will move to the last question, unless there's somebody else. Representative Koznick.
Thank you, Mr. Chair, and I do appreciate the latitude given to our side to ask some questions. I think it's a helpful discussion that we've had, even though the hour is late. And Representative Stevens, your comments are well taken. So I won't dwell into some of the comments that or questions that I had, but just more a little bit more procedural. What are kind of the differences between this and the companion bill? If you know, just for us going forward a little bit, I'm generally supportive of this bill. I think we can all agree that wage theft, and especially some of the atrocious examples that were shared, I think they were important to share. And I think we can all agree that that's wrong, and we need to be tough on that and support workers in that manner. But I am a little bit curious if you could take a little bit of time and share what some of the differences are in the companion bill.
Mr. Chair.
Chair Mahoney.
I haven't examined the companion bill. The actual companion bill to my bill, House File 6, is being carried by Senator Champion. Senator Pratt has introduced a separate bill, Senate File 1815 or 1833, I can't remember the exact number. His bill pretty much says, let's set up a program that pre-screens you so that you can put a plaque up that says, I don't steal your wages. I'm not sure that would be a real hindrance to somebody who is intent upon stealing or figuring out how to cheat other contractors or other citizens. But we'll work on that. I think I have a pretty high ceiling to negotiate, and Senator Pratt has a pretty low floor. So it will be an interesting negotiation. There's a significant difference. This particular bill will be one of the toughest wage theft laws in the country. I don't think Senator Pratt's bill moves the needle other than declaring wage theft is illegal.
I was just going to say one other thing, and I'm learning here, first guy on the committee, and you're doing a great job being a chair. Always makes your bill look better after $1 billion bill and the other more controversial bills, and did a good job presenting, making your bill look really well.
Thank you. Thank you.
Mr. Chair, I think you've got a good bill. It's about fairness, it's about dignity, it's about respect for those who are working very hard every single day. And I think for so many people, because of the existing labor trafficking and taking advantage of undocumented individual is really, really bad. So I think this bill will create a fair playing field for them. So with that, I just wanted to give you the closing remarks, and if you'll renew your motion before we take the roll call.
Thank you, Commissioner.
Thank you.
Members, House File 6, I could say a ton of things. I will say this, that an employer that uses this method, this business model, he or she is not only stealing from the employee, but there's hundreds of millions of dollars that are being stolen from us as taxpayers because they're not paying their unemployment insurance. They're not paying their workers' comp. They're not paying their federal or state taxes. They are not paying Social Security. They create an unfair advantage for fair business owners. For business owners that are trying to do the right thing, they are harmed dramatically, along with the rest of us taxpayers. I've heard wild numbers on what we as taxpayers lose to these types of employers. So I said hundreds of millions. I want to just be careful with that number. But if you have 40,000 people not paying taxes, if you have 40,000 people not having their unemployment insurance, and they will get unemployment insurance, you have 40,000 people not paying their Social Security or work comp, and we will take care of those people, even though they got stolen from, and somebody else got to go to the Bahamas. You know, again, I said earlier in this particular bill, if you steal from a bank, you go to jail. If you steal from your employees in Minnesota and in many other states, you could go to the Bahamas for some fun. So with that, members, I would ask for a yes vote on this particular bill.
Chair Mahoney renews his House File 6 to be referred to the Committee of Ways and Means as amended. The clerk will take the roll.
Chair Mahoney,
Yes.
Chair Newer,
Yes.
Representative Gunther. Yes. Representative Backer. Representative Claflin.
Yes.
Representative Dabney.
Yes.
Representative Eklund.
Yes.
Representative Haley. No. Representative Hassan.
Yes.
Representative Cagle.
Yes.
Representative Kosnick.
Yes.
Representative Meckland.
No.
Representative Moran. Representative Robbins. Representative Stevenson.
Yes.
Representative Sundin.
Yes.
Representative Zhang.
Yes.
Mr. Chair, 13 ayes and 3 nays. You are on to the Ways and Means. I think we are meeting tomorrow night, and I just wanted to say the bill.
We're meeting tomorrow night, room 10.
We're meeting tomorrow night at room 10, and what time? 7 p.m. With that, having no any other business before this committee, we are adjourned.